hearing. Today we're going to be covering a number of topics. We're glad that you're all here. I have been a little over-ambitious in my number of topics that I'm trying to cover. I think we have 15 speakers, and I'm trying to keep it to 10 to 15 minutes per speaker. We will try to answer a few questions after each one. But we are covering Kratom, Tianeptine, Fentanyl testing strips, CBD, Delta-8, and an overview of the medical cannabis program. So after today, all of you should have a pharmacology degree, and look forward to coming to see you in your drugstore. Today, our first testifier at our hearing is from the American Kratom Association. He's a senior fellow on public policy, Mr. C.M. Mac Haddow. Welcome, sir. He's come all the way from Virginia, and so I've told him if he wants to take a few extra minutes, he can. He's come a long way to sit in that chair, and we want to welcome you and look forward to your remarks.
Thank you, Mr. Chairman, and thank you, ladies and gentlemen of the committee, for this opportunity to meet with you today. The American Kratom Association represents the 15 million plus consumers of Kratom in the United States. We do not represent vendors. In fact, we're probably at odds with the majority of the vendor community on Kratom because we advocate for good regulations on Kratom products that are sold. I welcome this opportunity because it allows us to talk about Kratom, which is a dietary supplement that has been used for hundreds of years in Southeast Asia, came to the United States just after the Vietnam War when our soldiers came home, having used it in Southeast Asia during the war. They would pluck the leaves, chew on it, see the energy that it gave them, increased focus, and some of the pain relief to getting through long, hot days in the jungle. And so they brought it home with them. The Hmong population immigration just after the war also was instrumental in seeing a spike in use in Kratom here in the United States. The slide that I want you to look at here, and I think all of you have this, compares the terms under which the scheduling occurs in the state of Mississippi and the United States. And you will see they match exactly the criteria. This is the scientific area that is evaluated for any substance that is evaluated for scheduling. The three principal criteria are that if the substance is unsafe, it kills people. If it's dangerously addictive, then, and if those two criteria are met, and it has no approved FDA medical use, then it is subject for scheduling. That is the criteria that is used by the regulators in the United States under the Controlled Substances Act, and we would argue it should be the same scientific criteria the state of Mississippi would use as well. The Drug Enforcement Administration accepted the first scheduling recommendation from the FDA in August of 2016, and then subsequent to an outcry from the community, both consumers and regulators, scientists and law enforcement and veterans and a range of people across the spectrum who had an interest in Kratom, both as providers and as consumers, the DA withdrew that scheduling notice. That's significant because it was the first time in 82 previous scheduling recommendations, the only time that the DA actually withdrew a scheduling recommendation, and they did it because they believed that the FDA needed to provide the full 8-factor analysis that would show first that it's dangerously addictive. Under the Controlled Substances Act and agreements with HHS, the National Institute on Drug Abuse is responsible for signing off on any scheduling recommendation, and their responsibility is to look at whether or not a substance is dangerously addictive. And so they commissioned 2 studies that were done about the addiction liability of Kratom. The first was contracted out to a university and a group of contract scientists. The second was done as an intramural study. The HEMBI study was finished, and what it concluded was that there was no abuse potential for Kratom, but they observed in the test animals that there was actually a reduction in the attraction to morphine, which was the reference drug. And so that stimulated an interest by the National Institute on Drug Abuse to do additional studies. As well, the second study, the in-house study done by NIDA, showed that there was limited abuse liability and the potential for metrogene, which is one of the alkaloids in the kratom plant, a metrogene treatment to specifically reduce opioid abuse. Again, that sparked a tremendous amount of interest by the government in determining whether or not that was actually true. You will hear evidence and testimony that's provided to you that will contradict what I've just told you. And we are prepared to bring the scientists to Mississippi and convene a summit with any of those that disagree with these positions. We want to get this right, and I know you do too. We want to protect consumers as much as anyone, but we don't want opinions to be the dictating force in scheduling any substance. We want science to be that. And here you have NIDA taking the first step in order to look at it. The new study shows that when you hear about and people believe, and understandably they accept the fact that kratom hits the mu-opioid receptor in the brain. It does, as do many other substances. But what the new science is finding, that the kappa receptors are also activated, and that's important. And I know this gets a little wonky. It's important because the kappa receptors trigger pain relief. What the kratom alkaloids do is they're partial agonists. They bind to the mu-opioid receptor, then they hit the kappa receptors, which reduces pain, but they do not go to the respiratory system, which is why you get overdose deaths. They also don't go to the center for euphoric highs, which brings you back. That's where addiction takes place. That's the signature of traditional opioids. And the science strongly proves that kratom doesn't act like a traditional opioid, and all that evidence is there for you to look at in terms of the actual evidence. The FDA claims that kratom is unsafe and that their 8-factor analysis cites 9 deaths that occurred in Sweden in 2009 over a 12-month period. That appropriately got the attention of every public health official in the world. And when it happened, it appropriately had a FDA response when they went and imposed an import alert on kratom raw materials. But what the FDA, when they filed their recommendation for scheduling in both 2016 and then a subsequent scheduling in 2018, they cited those 9 deaths in Sweden, despite a peer-reviewed published article that looked at the blood reports and the autopsies of all of those deaths and found that they were actually caused by a kratom product that was spiked with O-desmethyltramadol, a very powerful opioid component that was responsible for those deaths. The adulteration of kratom products is a serious problem and one that needs to be addressed. We also found in a study peer-reviewed and published in 2016 that there were unscrupulous vendors that were artificially synthesizing one of kratom's alkaloids. There are more than 50 alkaloids in the plant. They operate as a symphony. And in their natural state, they do not create any safety problems that are significant or addiction problems. But when you artificially synthesize 7-hydroxymetrogene, which is one of the target alkaloids of the FDA, you have bad results. And this study proved that there were commercial kratom products that had elevated, synthetically injected 7-hydroxymetrogene that were dangerous. It proves that we simply have to stop the adulteration of kratom products. The United States, the Department of Health and Human Services evaluated the second recommendation by the FDA. They looked at all of the evidence that the FDA could provide, all the safety data, all of the addiction data, and all of the other information that's a part of those components of the 8 factors. And the Assistant Secretary for Health under the Trump administration in 2018 ruled that it was being withdrawn. And he said it was because of embarrassingly poor evidence and data and a failure to consider the overall public health, meaning that it did not consider all of the potential benefits of kratom being available to those people that were struggling with addictions and that sort of thing. All of these documents will be transmitted to you that I've shown you in these slides so you can see the original documents. The last bite at the apple by the FDA to attempt to get scheduling was done with the UN Commission on Narcotic Drugs. They have a much lower standard for scheduling than the United States does, but we are a party to the treaty, and if they were to schedule at the international level, we would be obligated to proceed with scheduling of kratom here in the United States. The FDA submitted what they called the kitchen sink of all of the evidence and data to appealing to a lower standard for review. The review by the UN Commission on Narcotic Drugs was conducted by the Expert Committee on Drug Dependence. 12 internationally independent scientists evaluated all of the evidence on kratom, and they had 3 choices. One, they could have determined that the FDA evidence was sufficient and that would call for immediate scheduling of kratom under the international treaties. Or secondly, they could have called for a critical review, which would have been a year-long process where the leading expert scientists in the world would have reviewed all of the information provided. Or they could have said that there was insufficient insufficient evidence presented by the FDA for scheduling, and they would put it under a surveillance status, which is where it has been. In a 12-0 vote on the issue of whether Kratom should be scheduled, they found that there was insufficient evidence to proceed to even a critical review, much less a scheduling. And that's with all of the evidence that the FDA could muster and present. It is critically important to drive this decision by the science, not by opinions, and clearly the FDA has a different opinion. I served the Chief of Staff of the Department of Health and Human Services in 1980, not 2000, 1980, and I saw firsthand the bias the FDA has against all dietary supplements, and it took the U.S. Congress in 1994 to finally draw the line and say, you can't do this anymore to the FDA, and that's why you have over 5,000 dietary supplement products in the United States that are legally available to citizens that they can use for their health and well-being and make their own decisions free from the restraints of the FDA. After the expert committee decision, 2 members of Congress wrote to the Secretary of Health and Human Services and asked, what is your position on Kratom? Why is the FDA continuing to expound this narrative that's anti-Kratom? The response by Secretary Becerra was that the HHS and its component agencies, which includes the FDA, are working to address knowledge gaps through research on Kratom. Those knowledge gaps are the evidence that's required for scheduling conclusively on Kratom. He also indicated in the letter, again, which will be provided, many Kratom-involved overdose deaths have occurred after the use of adulterated Kratom products or taking Kratom with other substances. Sadly, polydrug use leads to critical problems, as we'll discuss here in just a moment. Dr. Nora Volkow, who is the director of the National Institute on Drug Abuse, has authorized more than $30 million in studies. When she was asked by Senator Patty Murray in a appropriations committee on the Senate side in May of this year what HHS was doing to combat the drug overdose crisis in America, she said that there's expanding interest in other products that serve for harm reduction, including the use of Kratom. People are successfully finding Kratom to be an alternative that is safer than some of the products that are being used right now by the managed care community to treat opioid addictions. And so she's, of course, thought that that was critically important. When you look at the case reports, and these case reports are things that you see all the time, that there are reports of people that are using Kratom that also have organ failures in a number of areas. Those case reports need to be examined carefully, and NIDA, National Institute on Drug Abuse, just issued a paper on this saying case reports aren't determinative because they overlook many of the important factors, including whether the adulteration of the synthetic opioid, in this case Kratom, could have widespread health and social consequences, and the health impacts that are being attributed to Kratom, but rather are the actual problem with adulterated products. The result. The U.S. Congress in FY 2023 has passed on the House side this particular report language, combating opioid overdoses. The committee commends NIDA for funding studies on Kratom, and based on the promising results that unadulterated Kratom may provide help for some Americans struggling with addiction, giving its analgesic and less addictive properties as compared to opioids. On the issue of Kratom being an opioid, Dr. Scott Gottlieb told the American people in 2018 that Kratom was an opioid. Dr. Scott Gottlieb is wrong. All of the science now conclusively says that that is inaccurate. It hits the mu opioid receptor, as I've described, but that does not qualify it. Dr. Jack Henningfield from Johns Hopkins University, with the leading scientist, said Kratom is not an opioid by plant origin, chemical structure, pharmacology, or law. Or if it were, it would be scheduled today. In fact, if any of the information that the FDA has presented were true, Kratom would be scheduled today. It is not. It does not meet the criteria. The American Medical Association had a recommendation from the Mississippi State Medical Association, a resolution that they proposed for adoption that would have recommended the banning of Kratom at the federal level. A number of state legislators in the 7 states that have passed the Kratom Consumer Protection Act to date wrote to the AMA and questioned whether this was appropriate based on the science. And then the president of the American Medical Association, now the past president, Dr. Harmon, wrote back and said that they were not going to consider that resolution based on the science that had been provided to them. It is still an open issue as to whether or not that's the right thing to do. Dr. Garcia Romeo of Johns Hopkins University led a study that was done of adult Kratom consumers in the United States that were using it for opioid withdrawal. And he found that 87% reported relief from opioid withdrawal symptoms. That's the hardest part of getting off of an opioid withdrawal and not relapsing back onto it. He found that 35% were free from opioids, so using opioid, replacing with Kratom within a year. That's a very positive result, and it's why Kratom is not scheduled today, because it can be. It is not the panacea. It is not it doesn't work for everyone, but it can work for many, and that's why it's an important area for us to look at. Dr. Christopher McCurdy, who is the University of Mississippi, was his origin for Kratom research. He did a lot of cannabis research and started on Kratom. He's now with the University of Florida, and he's the leading Kratom contracted scientist by the National Institute on Drug Abuse. And he attributes the deaths on Kratom that are, unless it's an extreme circumstance, to overdosing for the adulterated or synthetic compounds such as fentanyl. Fentanyl today is the leading adulterant in Kratom products that are available to the public, and they should be eliminated. In an op-ed in Florida, where the KCPA, the Kratom Consumer Protection Act, was recommended for passage, and we hope will be done here in the state of Mississippi, he recommended that regulations are critically important in order to protect consumers of an otherwise unschedulable substance that really needs to be protected in the way that it's done. In a recent October 2022 Kratom Science Update, these four scientists call for regulation because we need to protect the citizens as best we can. What we propose is the Kratom Consumer Protection Act that would say in this state, seven states have already passed it, that if you introduce for sale any product in the state of Mississippi, it cannot be adulterated with any dangerous product. None of the alkaloids can be synthesized. No Kratom extract with residual solvents. When you create an extract, you can't use anything but food-grade solvents approved by the Food and Drug Administration. No Kratom containing an elevated 7-hydroxymetrogenine that is above the fraction that shows in a natural plant can be sold, and no product that is not labeled with ingredients and directions for use, and no illegal therapeutic claims can be made about Kratom, and we recommend no sales to minors under the age of 21, but we respect the jurisdiction's decision on that. That, we believe, is the solution. That, we think, is critically important to protect consumers in the marketplace. Without it, you will have people die. Without it, you're going to continue to have an adulterated market, so when you go to buy a product, you go to a convenience store or a gas station, or you go to a health food store, it doesn't matter where you buy it, you don't know it's safe unless it's regulated. So we hope that Mississippi will consider that. Mr. Chairman, thank you. I'm glad to answer any questions that anyone might have.
All right. Representative Curry, you recognize. Lady from Lincoln.
So much, and I'm going to figure this out. Okay.
Yeah.
Hadn't been here in a while. I'm not sure who this question's to. Did we ever make it age 21 here in Mississippi?
The history of what happened last year is that the sale of Kratom was banned in the House and the Senate did not take up the bill.
Okay, so that to me would be one of the main problems, is that we need to make an age limit. Like, you can't buy beer or cigarettes unless you're 21. So, and the other one, you've touched on it, and a couple of years ago we had some really good information about Kratom, and like you're saying, if it was pure Kratom and not have other gook in it, and that's the law that we tried to pass, I think, in the House before you were drug policy chair. But neither here nor there. I think the problem is polypharmacy is your main thing, which you really can't control. But I have gone for years not knowing how I felt about this, because, you know, kids can walk in a store and buy it. That's, I guess, my main problem. So, unfortunately, I did not make that in the form of a question, but I think it's time for us to pass at least that legislation.
Lady from Madison.
Thank you, Mr. Chair. Thank you so much for taking your day to come here. I know it was not an easy task to get here. Isn't it true that the state of Nevada has one of your model Kratom Consumer Protection Acts in place now?
Partially. They have not yet enacted the enforcement section of it. The Utah Department of Agriculture regulates it in Utah. Each state's a little different, but they are planning on, my understanding with the Department of Health and Department of Agriculture in Nevada, that they'll be adopting regulations on Kratom, which we support.
Well, I've seen recently a report from the Nevada State Unintentional Drug Overdose Reporting System demonstrating that from 2019 to 2020, Kratom overdose deaths actually increased by 50%, and for the first half of 2021, there was an even larger increase of overdose deaths. So help me understand, and how would you explain, given the Kratom Consumer Protection Act being in place there at this time, help us understand how that's going to help us here.
So two responses. One, all of that data predated the passage of the Kratom Consumer Protection Act, and the data that's coming in now, next year, I'm told, will be more illuminating on that subject. But the second response would be to look at the CDC report, where medical examiners across the country in that same time frame reported the CDC, and I'll send this report to everyone. They found that there were 91 deaths that were associated with the use of Kratom. When the CDC did their own independent evaluation of those reports, they found that all but 7 were polydrug use. If they had used more sophisticated analytical tools, they would have found that. So that's not surprising. Of the 7 that were determined to be Kratom only, 3 did not have sufficient blood samples for testing. The other 4, CDC applied more sophisticated analytics, and they determined all were polydrug use. So absolutely we have a problem with polydrug use and the adulterated Kratom products in the marketplace. We need to fix that.
Thank you.
All right, any other questions? Thank you, Mr. Haddow, for being with us today. I really appreciate it. Thanks for coming so far.
Yeah, and I reiterate my commitment that any questions that any of the following panelists have, we will convene a meeting, we'll bring the scientists in. That's where we should have this decision.
I think everyone's got a copy of your presentation, and that was fast. I didn't think that you were going to get through it that fast.
Well, you told me I had to. So
yes, you did great. You did great. Our next speaker is Dr. John Cross. John is the president of Dr. Cross, I've known John, been friends with for 20 years, is president of the Mississippi State Medical Association. He has the unfortunate happenstance to live in my House district, so you can pray for him to have better representation maybe. We're glad that you're here, Dr. Cross, and give you this time to make some opening remarks on behalf of the Mississippi State Medical Association.
Yeah, good afternoon. Thank you, Chairman Yancey and other members of our House Drug Policy Committee. I'm Dr. John Cross. I'm a board-certified internal medicine physician and fellow of the American College of Physicians practicing here in Jackson. And I serve as the 155th president of the Mississippi State Medical Association. My colleagues and I that are here today are representing over 5,000 of Mississippi physicians, medical students, and residents, practicing medicine from the Mississippi Gulf Coast to the Pine Belt, to Jackson, to its suburbs, to the Mississippi Delta, and up to the hills of northeast Mississippi. Over 5,000 of Mississippi's physicians. And as you know, right now in our communities, our physicians are performing surgeries, rounding in the hospital, seeing patients in clinics to improve the health of your neighbors and our small communities. Our physicians are leading the physician-led healthcare team. So here we are today, in front of the Drug Policy Committee. Our Chief Executive Officer is Dr. Claude Brunson, our Chief of Legislative Affairs, Dr. David Roberts, and the rest of us were here elected by the MSMA to volunteer our time to be the voices of those Mississippi physicians working right now as we speak. So all of us that are here today to speak, we're educated in Mississippi, we practice medicine in Mississippi, and we choose to raise our families here in Mississippi. As Chairman Yancey mentioned, we are Mississippians. So our association represents physician leaders that are very important to small communities throughout Mississippi. Studies show that our physicians can make an economic impact of over $2 million per physician into their community. Our physicians are not only your neighbors, but we're also your Sunday school members and we're your Little League coaches. So we're here today to bring your attention to 3 critical areas plaguing our communities across the state. And as mentioned before, we all know we're having problems with Kratom. You'll hear about Tianeptine, and you'll hear about the Fentanyl, and they're wreaking havoc on our Mississippi communities. You'll hear about Kratom being sold in service stations with no restrictions, and another story of destruction and addiction that this Kratom causes. You're going to hear about the next substance down the line, Tianeptine, or what they call gas station heroin. You also hear about our national fentanyl epidemic and its involvement in our Mississippi communities, and how an update to our statutes can help possibly prevent some of its devastation. The three physicians that we have asked to speak today are experts in our Mississippi communities. They're all on the ground with firsthand testimony about the severity of these destructive substances. Our first speaker is Dr. Randy Easterling. He's discussing the addiction crisis caused by Kratom. He's a former MSMA president. Dr. Easterling is a family medicine physician specializing in addiction medicine. He's also a member of the Academy of Family Physicians and the American Society of Addiction Medicine. He's practiced addiction medicine for over 35 years in Mississippi. Recently, he served as vice chair of the Mississippi Opioid and Heroin Task Force. The second speaker will be Dr. Jennifer Bryan. She's offering testimony on Tianeptine and the problems this substance is causing in our communities. Dr. Bryan is a family medicine physician in Flowood and past chair of our Board of Trustees. She currently chairs the Mississippi delegation to the American Medical Association. And then finally, Dr. Catherine Pannell will discuss the fentanyl epidemic and the importance of classification of fentanyl testing strips, a tool to combat and reduce the number of deaths from the contamination of fentanyl with other drugs. Dr. Pannell is a psychiatrist and medical director for the Right Track Medical Group in Oxford. She's board certified in psychiatry and neurology and a fellow in the American Psychiatric Association. She's also past chair of our MSMA Board of Trustees. So thank you again, Chairman Yancey, for allowing the Mississippi State Medical Association this opportunity to discuss these three critical topics.
All right, Dr. Easterling, you have the floor.
Thank you very much, Mr. Chairman. I appreciate the opportunity of coming and speaking with this committee and sharing some ideas. As mentioned, my name is Randy Easterling. I practice addiction medicine and family medicine in Mississippi for 36 years. For 35 years, I practiced in Vicksburg, and now I'm medical director of Harbor House, which is an inpatient drug and alcohol treatment center in Byram, Mississippi. I still live in Bovina, however. I'm a fellow with the American Academy of Family Physicians and a fellow with the American Society of Addiction Medicine. Prior to going to medical school, I was a psychologist, so I was an addiction psychologist for 5 years. As mentioned, I'm a past president of the Mississippi Academy of Family Physicians and Mississippi State Medical Association. I also served on the Mississippi State Board of Medical Licensure for 12 years and was president of that board for 2 years. We talk about experts. I was pleased 8 years ago when the AMA called me and asked me to come to Washington and testify before a U.S. Senate committee on opioids. So I was one of the first people to treat opioid use disorder in the state with buprenorphine. So, and to reiterate what Dr. Cross said, the three physicians you're going to hear from today are Mississippians, born and raised here by and large, educated here, married here, raised our kids here, we pay our taxes here, we take care of you, we take care of your spouses, we take care of your children and your grandchildren. Even though I have been past president of many of these associations, I'm here representing the thousands, if not hundreds of thousands of people that I have treated for substance use disorder in the last 40 years, both as a psychologist and a physician. What I want to talk about for a minute is Kratom, and I hope I'll leave a little bit of time that you can ask some questions. As mentioned previously, Kratom is a herbal extract from the leaf of a plant that's grown in Southeast Asia, mostly Malaysia and Thailand. It's touted to be used to treat depression, panic attacks, pain, anxiety, a number of things. You've heard some quotes from the FDA and from the DEA. This is from the Mayo Clinic. It's a consumer and health report, and it basically says that also, let me mention that you can chew the kratom leaf, you can grind it up into powder and put it in pills, you can brew it and make a tea, and you can also make a liquid out of it. Almost all of this is sold online and in convenience stores near you. At low doses, Kratom acts as a stimulant, making users feel more energetic. At high doses, it does to relieve some pain and bring about some euphoria. At very high doses, it's a sedative, making users quiet and perhaps sleepy. In all the studies that have been done, the risk of using Kratom far outweigh the benefits. To my knowledge, there's no scientific evidence that supports that Kratom does any of the things that it says it does, with the exception of things. Can you relieve anxiety with Kratom? Probably so. But you can relieve it with a fifth of Jack Daniels too. Can you treat your depression with Kratom? Yeah, but we know for a long time that substance abuse disorder, people that use substances treat their depression with these substances. So to say anecdotally that this helps in certain conditions may be true, but it's not healthy and it's not based in science. Also, although people who take Kratom believe in its value, researchers who have studied Kratom think its side effects and safety problems much outweigh the potential benefits. There was a line of thinking for some time by researchers that it may have some medical benefits. There's absolutely no studies that show that, no scientific studies that show that the benefit outweighs the risk. And that's important for everyone to understand. Every medication that you take is weighed the risk and benefit. I had a headache a couple hours ago, and before I left the house, I took 2 Excedrin. Well, the studies show that taking that Excedrin the benefits are going to outweigh the risk. It's just that simple, or it wouldn't be sold. Kratom has a number of known side effects: weight loss, dry mouth, chills, nausea, vomiting, changes in urine and constipation, liver damage, muscle pain, dizziness, drowsiness, changes in urine and constipation, liver damage, and muscle pain. Seizures, coma, and death have also been noted. In between 2011 and 2017, there were over 1,800 calls to poison control centers around the country concerning Kratom. A number of these, over half of them, were related to seizures and extreme high blood pressure. Some of them were related to death. There's very little research, if any, again, that shows the medical benefits. The FDA, this is the FDA and Kratom, has been concerned about this for years. How does Kratom work? Our previous speaker talked about the mu and the kappa receptors, and that's very true. We have receptors in our brain and our body. We have nicotine receptors, sugar receptors, caffeine receptors, and we have opioid receptors. The mu receptor is the primary opioid receptor. Kappa is also a receptor. If I take oxycodone, or I take fentanyl, or I take morphine, it binds to the opioid receptor. When it binds in a lock and key type mechanism, then that releases neurotransmitters. Those neurotransmitters then have the side effects that of relieving pain, some euphoria, sleepiness, drowsiness, and if you take enough of it, respiratory suppression and death. Interesting enough, Kratom does bind to the mu receptors. That in and of itself is strong suggestion that it is an opioid, and the FDA has said that it was an opioid. I want to read an email that I got 7 weeks ago from Esther Fay. You don't know Esther Fay, but she works at the Pine Belt Community Mental Health Center in Hattiesburg and Laurel area. Great lady that works with people that have substance use disorders, and she sent this email. Hi there, hope you're well. I've been asked about a 22-year-old pregnant female who's addicted to Kratom. She's asking about medically assisted treatment, and I honestly do not know if that is an option for her. She has Medicaid. Can y'all let me know if your experience thoughts in on this scenario, please? I would be grateful. Thanks, and we'll talk soon. I work on a SAMHSA grant that basically pays me to do medically assisted treatment. Now, I do it face-to-face, I do it by telemedicine. I take care of, by definition, people that have no insurance or underinsured, okay? That's my patient population now. Within an hour, we hooked up with this lady, did a telemedicine, consult with her. She was in the Hattiesburg area, I was in Byram. She's 33 years old, at that time was 23 weeks pregnant, had a history of crystal methamphetamine addiction and oxycodone addiction. She was using 2 bottles of Kratom a day, 16 ounces per bottle, so she was drinking 32 ounces of Kratom. When I saw her, she was going through withdrawals, she was diaphoretic, she was congested, she had diarrhea, but she was 23 weeks pregnant. Now, the physicians in this room know that the last thing you want to do when you're pregnant is go through withdrawal. We saw her, and within an hour, we had her on buprenorphine or Suboxone. And what buprenorphine does, it's a partial opioid agonist. And by the way, there's no evidence that Kratom is a partial opioid agonist. It's not. Buprenorphine is a partial opioid agonist. What it does, it binds to those receptor sites and blocks and keeps the opioids off. It's a lifesaver. So we had her on this medicine within an hour. I followed up with her a couple days later. She looked perfectly good. She's doing fine. I've seen her for the last 7 weeks. Hopefully she's going to have a healthy baby. There's been studies that shown that infants that are born of mothers that are addicted to kratom have what's called neonatal abstinence syndrome. We've known that for years. And that's where the baby is addicted to the opioid, and you have to withdraw that infant, okay? The average infant that's born here in Jackson, Mississippi, if they're normal birth weight and full term, stay in the hospital about 24 hours. Someone with neonatal abstinence syndrome stays in an average of 3 weeks. And you have to detox them with morphine. So you're giving babies that weigh 6, 7, 8 pounds IV morphine 4 or 5 times a day. That's what happens with these infants. Talk just a second about where do you get kratom. In front of you, you have some pictures here. You can get it online. You can buy it at your local convenience store. Now, I'm not a photographer, but my wife and I went to the coast 7 weeks ago for our anniversary, and on the way back, we stopped in Richland to get gas and go to the bathroom. When I walked in the convenience store, this is the first thing I saw. These are 2 shells of kratom, strategically placed at the entrance of the store where you see it when you go in and you see it when you go out. The odd thing about this, and Representative Curry, you mentioned this, in passing, but if I'd had my 5-year-old granddaughter with me, or my 10-year-old niece who lives in Petal, if they had gone and got a pack of cigarettes or a 6-pack of beer and taken it to the counter, they couldn't have bought this. It would have been illegal. But they could have gotten the kratom and bought it. It would have been perfectly legal. Is there something wrong with that picture? Number of bans. Right now, Mississippi as a whole has not banned kratom, but there's 39 bans, 12 counties and 27 cities. The counties are Alcorn, Tishomingo, Prentiss, Itawamba, Lowndes, Union, Tippah, Calhoun, Noxubee, Marshall, Grenada, and Lafayette. And there's 27 cities, and you can read those there. The most recent one is Houston, Mississippi. This article came out on February the 16th, 2022. A prominent businessman in Houston was addicted to kratom. His habit was $2,000 to $3,000 a day. He became delirious, delusional, was put in jail because of his behavior. Pardon what I'm going to say, but he was noted to be eating his own feces. This was a prominent businessman, and he later died from kratom addiction. We already have enough FDA-approved medications that, if used correctly, are beneficial. There is scientific evidence that taking hydrocodone and taking morphine and even fentanyl in some cases, certainly in dying cancer patients, is beneficial. But look at all the problems we have with those. Why do we want to continue to sell something over the counter that in a lot of studies is just as dangerous? It just makes no sense whatsoever. We have fallen into a false sense of security that the opioid crisis is over. And folks, I'm here to tell you, as someone that does that for a living, the opioid crisis is worse. In the year 2021, we will lose over 103,000 Americans from accidental drug overdose. About 75% of those will be opioids, and of that, about 50 to 60, if not greater, are going to be fentanyl. But what's happened in 2019, 2020, this little interesting virus came along and knocked the opioid epidemic off the front page. Okay? So what we've been concentrating on in terms of collecting statistics and then news reports and so forth has been the coronavirus, and rightly so. And at the same time, the opioid epidemic has just seethed and gotten worse. Last year, we're going to have as many as 500 reported deaths in Mississippi, accidental overdose deaths. I can remember when I was on the medical board and we were rewriting our chapter on prescribing, those numbers were in the maybe 100, 125. So they've doubled and tripled in the last 2 or 3 years. And there's no sign of any letting up. So, I have a few minutes left, I believe. If anybody has any questions, I'll be more than happy to answer them. But I can tell you, I think most of us as physicians consider ourselves scientists to some degree, but we're not bench scientists. We don't sit there with a Bunsen burner and pour things in tubes. We take care of people. And I can tell you, and there's some other addictionologists in this room, Kratom is dangerous, it's an opioid, it's addictive, and it kills people.
Thank you, Dr. Easterling. Are there any questions from the committee? Representative Curry.
Since you said that we're going to have 500 deaths, I'm curious to know, is that going to be from illegal means of getting opioids or prescription?
It'd be a combination of both, and I would assume Mr. Maxwell's here. He would probably have more specific information on that. But they're classified as accidental overdose deaths. And let me say this, and this is important. These numbers are drastically underestimated. Drastically. They're reported by the local coroners, which sometimes report it accurately, sometimes they don't. But, you know, if you find somebody 65 or 70 years old, or sometimes people in a car that have passed out and are dead, a lot of times autopsies aren't done, the correct chemistries aren't done, and I would say easily it's twice that number, if not greater.
All right, any other questions? Thank you, Dr. Easterling. I appreciate you being here today. Our next speaker is Dr. Jennifer Bryan. She is going to speak to us about a drug you probably never heard about, Tianeptine, also another gas station drug. Dr. Bryan practices in Flowood, in my neck of the woods, so
Everybody's in here.
when you get to be chairman, you get to have people from your neck of the woods come be in your hearing.
That's how you got to be chairman.
That's right.
Well, I've heard before that there's a little politicking going on in Rankin County, so
No doubt.
we were raised up right.
Yeah. So thank you for being here, and tell us what Tianeptine is.
So thank you again, Chairman Yancey, for having me and asking us to speak today at the Medical Association. To those of you who I've not met, my name is Jennifer Bryan. I am a family doctor in Flowood. Currently, as Dr. Cross mentioned, I am the chairman of the Mississippi delegation to the American Medical Association. I serve as a delegate there. I am past chairman of the board of the State Medical Association, where I previously served 3 consecutive years in that capacity, and I appreciate the opportunity to be here and speak about a couple of substances, actually, that I'm well versed in. I wanted to start off with something that I noticed today. I just appreciate the education that we have received. You know, we have a lot of folks come to Mississippi to teach us about things, and I wanted to use this time to thank our legislators for your support of our public academic institutions. So I was educated here in Mississippi, a public high school graduate at Brandon. I went to Mississippi State. I went to the University of Mississippi Medical Center School of Medicine, and completed residency. I've been a scientist most all my life, and I understand exactly what I'm speaking about today, so I just wanted to go ahead and put that out on the table and say how much I appreciate your support of public education. Kratom, I just wanted to touch on a minute, since I authored the resolution that a previous speaker spoke about that went to the American Medical Association. So President Jerry Harmon, at the time at the AMA, is a personal friend of mine. I've had dinner with him on several occasions. He's a family medicine colleague. I'm also friends with the immediate past president of the American Medical Association and the current president, Drs. Resnick and Ehrenfeld. I'm not saying this to be fancy. I'm just saying I didn't get any questions about the resolution that I wrote, which I would be happy to answer. I wrote it in 2019. When I Googled the term, I couldn't find anything. There was nothing. And the reason that I Googled it was someone that was married into my family, I found out was on it and was spending a lot of my loved ones' money, thousands of dollars, as someone previously referenced, monthly, buying it online. I saw a niece and a nephew lose their mother for all practical purposes to Kratom. And I happen to know politically how to write a resolution and get it passed to the House of Delegates and to take it to AMA. I'll tell you that I pulled it from the American Medical Association and will bring it back. It will be back for consideration. And the reason I pulled it is we're working with our medical student leaders on finding something that the young folks agree on across the country, and not because there was any admonishment or negative advice from the AMA. And so I'm going to move on from Kratom, but I am happy to continue to speak about that or answer questions since I've been championing it since 2019. So my dad was previously Mississippi's federal public defender, and decriminalization is a big topic that comes up with all these substances. And I just wanted to put out there, if it does come up, that's not what this is about. We're not about putting folks in jail. We're not pushing for negative consequences for Mississippians. This is about physicians understanding the science and preventing further addiction and worsening of an opioid crisis. I understand overpopulation of prisons and jails, and certainly there are things that we can work through here that can keep our kids safe, can keep our families safe, and also not be so punitive against the public, because that's not my goal, and I don't think it's really anyone's goal that's working for the safety in this situation. As we move on to Tianeptine, I wanted to comment on the difference in regulation. That's a fancy, shiny word that gets thrown around a lot, like we feel safe because it's regulated. But the FDA has a couple of pathways in regulation. One is like food and dietary supplements, and the other one is prescription drugs. So if you have cancer and you want that chemotherapy to target your cancer, it's regulated very stringently. It's a whole different process. That's an entirely different process than if you go to take a food supplement that you get at GNC or at Walmart or wherever. That is not as stringently regulated. So if we do decide to do something, which I would recommend against, we do need to understand that regulation really doesn't mean that much. It's much looser on that side of the FDA, and I'd encourage you to look at that when you're considering things. Many of the dietary supplements do have biological effects. They can conflict with the medicines that the patients are taking, and they do. We see them all the time. What medicines are you taking? What supplements are you taking? Because they interact. They cause heart conditions and liver conditions and kidney conditions. So this is a problem that we deal with every day with our patients. And the FDA even put out a cautionary measure talking about all those things that's publicly available, and talk about you should consult with your physician, right? The scientist, the physician, about whether you should take this over-the-counter supplement. The FDA knows they have a problem on their hands. It's a backdoor way to get medications or toxic substances of abuse into the gas stations. And companies are definitely taking advantage of this backdoor opportunity and making a lot of money. Tianeptine is also known as Zaza, gas station heroin, Tiana Red. There are a lot of different names. So far, there's either a ban or a Schedule I situation in New York, Michigan, Georgia, Tennessee, and Alabama. Most recently, Italy has banned it outright. It started in the 1960s by French discovery, and it was used as an antidepressant and an anti-anxiety medication. Like Kratom, it has a strong opioid-like property. So it binds to what's called an opioid receptor. There are some differences in these terms, but any opioid agonist, so you have an antagonist that works against something, and then an agonist that encourages it. If it is an opioid agonist, then it is encouraging opioid-like effects. So it doesn't matter to me if it is an opiate or an opioid or an opioid-like or whoever defines what. If it makes them high and euphoric, then let's call it what it is. It has opioid properties. And the data shows that most people who use these medications are treating their pre-existing opioid disorder. And they would be much better served by following up with my addictionology colleagues, and we would be better served in supporting them in that. I had a patient in last month who was a wonderful mother of a couple of kids. She was suffering depression, and a girlfriend told her to try out the new gas station medication for depression, and she did. And I'll have you know that after 2 or 3 doses of Tianeptine, she was hooked. And she came in, and it took a while to even get it out of her, but it was clear something was wrong, and I sat with her, and I talked, and it finally came out that she was taking 8 of these a day, which was just a massive amount. It does take a good bit to induce the euphoric effect that people are after, there are toxicities associated with taking such large amounts. So not only is it there, but and expensive and all of the things, but they're having to take a lot of it, and it's inducing a lot of other problems in the body. So it's emerged on the illicit drug market, Tianeptine has. The CDC data from 2000 to 2017 has noted a rapid and marked increase in Tianeptine-related calls. It's, according to recent case reports, abuse for euphoric properties. Adverse health effects occur, such as respiratory depression, severe sedation, and death. And I want to hit pause a second. You know, we're walking into the medical marijuana age in our state, and we've been a conservative state a long time, and we are good folks raising our kids up in the right way. I am concerned about our ability of our overworked healthcare workforce right now post-COVID in handling all of this. I really am. Over the next few years, we don't know what medical marijuana fallout's going to look like in this state. And I don't know that in my practice, I'm even prepared to handle a post-COVID medical marijuana Kratom Tianeptine practice. We need help. I got to treat blood pressure and heart disease at some point. So without all the serious things, we've got nausea, constipation, dry mouth. It also mimics the opioid toxicity and withdrawal that we talked about earlier. So all of those bad symptoms are there, and patients are left still empty-handed. They have no real fix for the problem that we should really be working on helping them with, which is substance use disorder and addiction. And I heard some good kind of thinking out loud about age limits, earlier. I think that's really good, like problem solving. I mean, I would definitely question some of that because it's just so dangerous. I know kids got into wine coolers when I was coming along, and like Bartles and James and stuff, like that was the worst thing that people were doing back when I was coming through. But we don't have to fill the gas station up with more stuff that's going to cause opioid crisis stuff to our young folks and to our young adults. We don't have to have it there. And this kind of leads me to my closing comments, which is, I feel like every year we have our personal liberty argument, which I'm totally for, versus the substance abuse. Like, here we are again. We are the fuddy-duddies keeping the next fun thing out of the people's hands. It's bath salts, it's spice, it's kratom. Are we going to pass medical marijuana because we need you to do that? Now it's Tianeptine. It's not going to stop. It's like putting a finger in the holes in the dam. So we've got some decisions to make. It costs us a lot of money and time. Like, we're out of the clinic. I'm glad to be here. I know I'm going to be pursued again by Kratom and Tianeptine folks like we were last time, but that's okay. It's worthwhile to be here. It costs a lot of money to lobby these issues. Look at all the staff around your time, our time, and every year, like bringing in all these people for the next thing that people want to do to get high. So, our state health officer is an addictionologist, internal medicine physician. He happens to be amazingly brilliant, and he used to be on the AMA delegation. Dr. Easterling, also very brilliant addictionologist, member of our AMA delegation. So we're national leaders in addictionology. I'm not. I just hang around people that know a lot. And so we catch these things coming soon. Mississippi has a chance to lead. They look overseas. Dan Edney says, hey, watch out for Tianeptine. We start talking about it. We passed Tianeptine at AMA this summer. And when we did, you know how I got it passed? I don't think a person in the room even knew what it was. By next summer, it would have been much harder. So we can stay ahead, and I think we have an opportunity to lead in that space, but also I would encourage us all to start problem solving how we stop this in the first place. We've got an addictionologist at the state health officer position. I think there's an opportunity to use that physician's expertise to hit a pause, to screen, like, hey, there's a problem coming, red alert, and then maybe shut down problems before they happen, so we don't have to do this year after year, and I would just appreciate y'all considering that, but we will come back next year if there's another one to consider. Thank you so much for your time, and I'm happy to answer any questions.
Thank you, Dr. Bryan. Are there any questions from the committee?
I'm sorry.
The lady from Lincoln.
Okay, so this is a new one for me, and I've even Googled it 3 times while Dr. Easterling was talking, but I can't find out what we know what Kratom is made of, but what is this one?
So Tianeptine is actually a chemical compound. So Kratom is the plant, right?
Okay.
And I should have touched on that, and I'm sorry. So it is a drug that actually is a drug in other countries like France and Russia. They use it IV in Russia. So they treat depression, anxiety, they treat pain. But they have the respiratory depression and the death and the opioid addiction and withdrawal that goes with it. So in the United States, it is not approved for safety concerns. I don't think it ever will be approved on the drug pathway, right? So it's it has that prescription.
It's a new one, like you said, every year. I mean, we banned Sudafed one year, okay? We've been doing this a long time, and so this is a new one, and I agree with you. I think that it will be this.
Oh, yeah.
You know.
And I think the most important thing to consider, we all want data, but by the time we wait for the data, it's too late. People have died and they're addicted. So we utilize our expertise. We've got addictionologists in positions of authority in our state that can help us. And it's, y'all, we're leading the country here. It's how we got ahead. I mean, when he says that Mississippi State Medical Association brought forth a resolution to the AMA, we did. And we brought Tianeptine, and we're going to keep bringing them because we see them before anybody else sees it coming.
So one last thing, and I apologize, but I
please.
heard you say the red heroin or yah-yah or something. So I don't know if I walked in, because I do that, like Dr. Easterling, he saw it. I want to look at it and see what other people are seeing.
Right.
What do I look for? I mean, what is the name?
So Tiana is spelled Tianaa, I believe.
Okay.
And another brand is Zaza. It's Zaza. Yeah. And I think one is red. And Dr. Edney, maybe he can speak to some of that. He knows it better than I do. But yeah, that's the gas stations are interesting. It's almost like you have this pseudo pharmacy when you walk in all different colors and fancy names, and it's so dangerous. And I'm a mom of a 9-year-old and 2 11-year-olds. It scares me.
All right. Gentleman from Lee, Representative Thompson.
Dr. Brown, thank you for coming today. I have this thing I want to ask you. How many patients are you actually treating for Tianeptine now in your practice?
So thankfully, right now that I'm aware of, I have the one that I told you about. I'm a family doctor. We are on the cusp of this. It's coming. Now, we're seeing it, right? But I wouldn't imagine any family doctor has a huge panel of Tianeptine at this point, but the addictionologist would have a different story.
So is it pretty hard to diagnose when they come into your Tianeptine? You pretty used to any symptoms that they're having? What's so profound about it that gets your attention when it comes to Tianeptine?
Yeah, no, that's a great question. No, I mean, especially patients you've been seeing a while. You know, they come in, they're really down on their luck and their erratic behavior. You look for those kind of warning signs. Maybe they've had some family strife, all the socioeconomic things, and you start asking about substances in general, just as part of that history. And eventually, there are only a few things that are available right now out there. Gas station heroin is the big one right now that's out there that's coming on the rise. But Kratom, I would say, probably is more widely abused right now. But by next summer, it'll be Tianeptine.
My last question. What type of packaging, since I'm kind of new to this and learned about it today, what type of packaging is a Tianeptine, and what does it look like when you go in the store to purchase it, anything like that?
Great question. So I usually get my gas out at the pump and don't go in because all that stuff just drives me crazy. But from what I have seen, there are all these bright colors and red and green and the lights, and it's got, it's just flashy. It's the packaging itself. I'm certain we can get from MSMA some pictures. I'll be happy to email it over to the committee and take a look at that. But it's bright colors, it's fancy names, it's fun, it's singy, like I said, Tiana Red. Those are the things, and it's like anything. There'll be 10 different brands of a compound. The medical compound is called Tianeptine. It's just whatever they think is going to sell the easiest, I would imagine. Okay. What's going to draw your eye to their product.
Okay. Thank you. I'd like to see some of those packaging if I could get someone else, okay?
But you asked a great question. Like, how much experience do I have in this? I mean, not that much, thank goodness. That's where our opportunity is. But by next summer, I'm going to have a lot more experience like I do with Kratom. And by the time you get the data, it's too late.
All right. Any other questions from the committee?
Tianeptine primarily is structured like that tricyclic antidepressants. It's more so got online, so it comes just in packaging. You order it online, even though you can't get it in the convenience store. I've treated 2 addicts in the last couple of months, one the son of a physician, and I can assure you they're just as addicted as you would be to morphine or oxycodone. Thank you.
All right, thank you, Dr. Bryan.
Thank you again for having me. I really appreciate the opportunity.
Our next speaker is Dr. Catherine Pannell. She's past chair of the Board of Trustees, Mississippi Medical Association, and secretary of the Mississippi Psychiatric Association. And she is going to talk to us today about fentanyl testing strips and what that means. And I'll go ahead and give Colonel Maxwell a 15-minute warning that he's on deck.
Thank you, Chairman Yancey, for having me today. This will not take much time because it truly is a no-brainer. I apologize to those. I've had extensive conversations with Representative Ford, Representative Creekmore, Chairman Yancey, so some of this may be redundant to you, but we can't talk about this enough because it is that serious. There are stories every day on the news about fentanyl overdose deaths. I don't have to educate you about fentanyl. We all know how horrible it is, how deadly it is. My community of Oxford, I'm a psychiatrist in Oxford, has been hit really hard by the fentanyl crisis. We've had several young adults die from fentanyl poisoning. I'm not a big statistics person, didn't love it in college, but I did want to give out a few statistics just to show you how serious of a fentanyl crisis that we are in. In the last 3 years, we have seen over 500,000 die of an overdose. Over 70% of the drug deaths in Mississippi are due to fentanyl. Overdose deaths are the #1 cause of death in the 18 to 45 age group over suicide, motor vehicle accidents, drug death. This one's really got me because I have kids in this age range. Drug deaths amongst children 10 to 14 have more than tripled since 2019. And 4 out of every 10 pills are laced with fentanyl, and I'll argue that that's actually more. So this is not just an issue amongst those with a substance use disorder. However, I think many see it as that, which worsens the stigma surrounding fentanyl test strips that could save so many lives. Many of these deaths are occurring in young adults without any substance use disorder. Some are dying with their first use because they can't even tell that a pill is laced with fentanyl. So how do we prevent these deaths? Because currently nothing's working. It's getting worse, and it's going to get worse before it gets better. The issue with illicit fentanyl is that we cannot feasibly control the supply. Fentanyl is so powerful in such small amounts. It's tasteless, it's odorless. So you can transport very easily a large amount in a very powerful amount in just a small quantity because it is so powerful. Law enforcement can't realistically reduce the supply because it is coming in across our borders, it's via the dark web and through the mail. So if we can't control the supply, what do? We have to control the demand. The quickest, most effective way to do that is through education and harm reduction with fentanyl test strips. Representative Creekmore, big fan, has worked so hard on the education component of this. He has great legislation that he introduced last year that would get education into our schools. He's reintroducing it this year. Will cost the state no money. I'm here today to urge you to support legislation to decriminalize fentanyl test strips. Multiple states, close to 30, have already done this in some capacity. Fentanyl test strips allow someone to put a small strip of paper onto a substance that has the potential to be laced or poisoned with fentanyl. If there's fentanyl, a line will appear. These strips cost about $1 a piece and are about 96% accurate. They can detect 10 fentanyl analogs. This could keep a college kid from taking that Adderall at a party or in their dorm room trying to pull an all-nighter studying from dying. Right now, however, in Mississippi, fentanyl test strips are not even an option in our fight in this crisis because they are considered drug paraphernalia and are against the law. To me, that is the part that's criminal. There is a $30 million federal grant for fentanyl test strips that we could be accessing right now to get strips in our state, but we can't because they are considered illegal. We are losing 1 American every 5 minutes because of this epidemic largely driven by fentanyl. We need to be using every tool available to us. Places that distribute fentanyl test strips are often linked with community programs that can offer connections with treatment services such as healthcare and other social services like housing, which is a known factor in relapse. These fentanyl strips will not be distributed at college football games like pom-poms. They are connected to distribution sites that educate people that come in for these strips. They can provide resources for them, tell them how to get to detox, how to get into rehab and recovery. Fentanyl test strips do not enable drug use. They prevent accidental overdose. What they do enable is a person with a substance use disorder another chance at life, another day to contemplate rehab and recovery. Everyone is capable of recovery, everyone. However, I can't get them into recovery if they're dead. Fentanyl test strips reduce death and offer another chance at recovery. Thank you.
All right. Lady from Lincoln, Representative
you.
Curry, has a question.
I have grandchildren in college, so I would buy some. Can I buy them online?
I'm not sure. I mean, Amazon, you can pretty much buy anything. I've not tried.
Okay.
But if you're caught with it, then you
Right
could...
now,
really?
it's considered paraphernalia right now.
Oh,
Yeah,
I'm
so if you're caught with it, you can go to jail.
But I'm thinking, I need to order them today.
No.
Now we have the chair, the director of the Bureau of Narcotics coming up next. Lady from Madison, you're recognized.
Thank you, Mr. Chairman. Would you explain to us the importance of the drug that you can administer, the first responders administer, Narcan, how important it is, and how, as a legislature, we should be making sure that everyone has accessibility to that?
Right. Now, naloxone or Narcan reverses opioid overdose. The scary thing about fentanyl and carfentanil is that it often takes more than one dose to reverse the effect. So you may need multiple doses of Narcan. Thankfully, legislation has passed that we can get this over the counter now. I know in some states, they're even supplying schools with Narcan because this has become such a big issue. I don't know if that answered all of your questions, but yeah, Narcan, we do need to have it readily available. But fentanyl test, let's not even get to that point. Let's just, have the strips on hand so that we don't even use it to have an overdose and need to have the Narcan.
Recognized gentleman from Lee, Representative Thompson.
I want to thank you for what you do for the community. I want to know, were you aware of House Bill 496 that was dealt with test strips that we passed in legislation? Were you aware of that bill?
I'm not aware of the specific bill, but I know that there was legislation that had it in there that didn't.
Yeah, so that's one thing that we would just like to remind everyone that in lines 236 to 238, we're just trying to be proactive and everything, so I want to make everyone aware that we did try to pass something. Now is the time to really do something about it, because we have somebody who's out here trying to save lives, and everything that you have in your toolbox is so important, and you're talking about test strips and anything that can help. We just need to just move forward, so we just want you to be aware that we did try to pass something. Hopefully in this next legislation, we see the problem now, that we be able to deal with it, and we have something out there to work with you to give you the tools that you need to save someone's life with the test strips.
Yeah, it was heartbreaking to see that die and not get passed. Now we have to wait essentially another year and watch all these deaths occur before we get this hopefully passed this year. And I think a lot of that is due to misinformation, that people think that if you're giving these test strips that you're encouraging them to use drugs. These people are ill. They have a substance use disorder. They are going to use. Provide them with harm reduction, these fentanyl test strips, so that they can live another day and contemplate going into recovery, spend time with their families, and make that decision to go into rehab. Because like I said, everybody has the potential to recover.
I don't think Representative Creekmore for introducing that, so maybe next year we'll get something done on that behalf.
Good job.
Thank you, Dr. Spano.
Yeah.
I now recognize Colonel Stephen Maxwell, Director of Mississippi Bureau of Narcotics. He's going to talk to us also about anything he wants, number one, but number two, about the, decriminalizing the fentanyl testing strips, because he's the one that will put us in jail if we don't decriminalize it. And anything else you want to talk about, sir?
Thank you, Representative Yancey.
Yeah.
Good afternoon. How are y'all doing?
Oh, we're fine.
My name is Stephen Maxwell, and I work for the Mississippi Bureau of Narcotics. I've been working for your Bureau of Narcotics for approximately 28 years. I appreciate the opportunity that Representative Yancey and other members of the legislature is giving us today to visit with you all. However, it's unfortunate. I want to tell you about a conversation I had this afternoon with one of our district captains, and we were talking about an overdose that occurred about 2 weeks ago. And although we had not seen a drug overdose that could be contributed to Tianeptine, today I can say that we have had our first confirmed overdose as a result of a product that was purchased and consumed by a Mississippian over the counter legally here in this state, and it occurred in the Pine Belt. In addition to that, 2 weeks ago, I was communicating with a healthcare professional, and they were telling me about a nurse practitioner who became aware of, frighteningly, that their daughter was addicted to Suboxone. They had no idea that their daughter, their young teenage daughter, middle school age daughter, was vaping. And their teenage daughter was purchasing the vape cartridges over the counter at a convenience store here in the state of Mississippi. The next story I'd like to tell you about is a middle school student here in the state of Mississippi having a conversation with school administrators. The question was posed to her: what is the problem? What can we do? Vaping is out of hand in our school. I might say it's out of hand in every middle school and high school in the state of Mississippi. So much so, the school districts have had to invest in vape detectors. This young middle school student looked at the school administration and said, "It's too late for us. We are already addicted. Y'all need to talk to those elementary school students." And again, addicted as a result of being able to purchase a vape cartridge over the counter in convenience stores throughout the state of Mississippi. As Dr. Panel highlighted, we are not talking about adults who are already battling substance use disorder, okay? We're not talking about individuals who are 21 years and older. We're talking about the future of our state. We're talking about our sons and daughters, nieces, nephews, our grandchildren. These convenience stores happen to be conveniently located by our elementary schools, middle schools, high schools, parks and recreational centers, and states in every community across this state. This issue, as it relates to drug overdose, substance use disorder, behavioral health issues, mental health issues, it's not isolated to one demographic or one community. To make things even more frightening, the 2020 SAMHSA survey on drug abuse and health indicates that here in the United States, 670 adolescents initiated prescription opioid misuse. Now, those medications were retrieved from a home medicine keeping cabinet or space. But now, as Dr. Easterling highlighted, Kratom, an opioid, can be purchased over the counter. So no longer do kids have to go and rifle through the parents' medicine cabinet or keeping space. There's a convenience store conveniently located by their middle school and by their high school. And these kids become more susceptible to developing substance use disorders, mental health behaviors, and behavioral health issues. We are expecting them to make a decision about what they should and should not ingest in their bodies, and they don't even have high school diplomas. So thank you for allowing us the opportunity to visit with you today. In 2019, the Mississippi Bureau of Narcotics became aware and concerned about products that could be purchased over the counter at convenience stores throughout the state of Mississippi. As a result of that, we've worked with district attorneys' offices, the U.S. Attorney's Office, our federal partners, and local agencies in an attempt to address this problem. And I can tell you right now that it is statewide. Some of the investigations that we have worked have come to fruition in working with our state district attorneys and our federal prosecutors, and some of them are ongoing. The evidentiary data that we have acquired as a result of sampling and testing these products highlight a primary issue, and the primary issue is labeling. Some of these products contain toxic chemicals that are not listed on the labeling. Some of these products contain amounts of illicit and illegal chemicals, Delta-8, Delta-9 THC, ranging from 0 to 78%. Now, with our new medical marijuana law, our new cannabis law, a product cannot be produced containing 78% THC. But there are products being sold over the counter right now in the state of Mississippi that can be purchased legally that contain THC up to 78%. Then another problem. Some of these products contain substances, additives, illegal chemicals that are not even listed on the labeling. Synthetic cannabinoids, isotonitazine, protonitazine, metanitazine, drugs that are believed to be more potent than fentanyl, but not as potent as carfentanyl. In products that are being sold over the counter in your communities, in our communities, right now, and they can be purchased. This is as a result of products being tested by our Mississippi State Crime Lab and in partnership with the University of Mississippi working with Dr. El Soli. Now, I want to tell you this. These products that have been purchased consist of vape oils, hemp powder, CBD, gummies, and candies. The question was asked about packaging. The packaging is so similar, the marketing is so similar to any bag of chips, gummies, candies that can be purchased by any child or any parent for a child in any convenience store across the state of Mississippi. I was having a conversation with some parents, and I explained to them, I said, I can put 3 gummies in front of you. I can put 3 gummies in front of a scientist, a doctor, a pharmacist, a lawyer, 3 gummies. And you will not be able to tell the difference between the gummy that was manufactured by a reputable candy corporation, the gummy that's prescribed by a physician for a medicinal issue after having treated their patient, and a gummy that is laced with fentanyl, Kratom, containing a THC content of 78%, or any of the other synthetic cannabinoids, because they all look the same. And if we as professionals cannot tell the difference, how do we expect our elementary school, middle school, high school, and college-age children to tell the difference? Thank you, Representative Yancey. I think we have an opportunity here today, going forward, not only to help individuals who are battling substance use disorder, but to help our children. To put our children in a position where they don't have to make this decision. Last story I'll tell you is this. I'm talking with a parent, frantically, and this parent was asking the question, why is it that there are cars lined up out of the parking lot into the street at this convenience store that's near the high school? Why is that? Well, I can tell you why. Because the kids are going by in the morning before they go to school to pick up their vape cartridges. That's why. Not to pick up a Coke, not to pick up a Snickers or a pack of gum, not to pick up a Mountain Dew, but they want to get their vape cartridges and possibly their Kratom while they're in there as well, in powder or capsule form. And I want to say something about Tianeptine. I was just in one of our businesses here in the state that sells a number of things, bongs and hookahs and pipes and so forth and so on. And there I saw the Tiana Red. And my mind just went back to the overdose that I mentioned to you earlier. And when you go in these stores, I mean, these hookahs are so elaborate, the bongs, and they're not very cheap. They're relatively expensive. And Representative Yancey mentioned fentanyl test strips. I want to tell you this. The Bureau of Narcotics is in support of making fentanyl test strips available for Mississippians who are battling substance use disorder, for their family members who are in support of them, who are in the fight with them as they deal with substance use disorders. Families in Mississippi need all of the options available to them as they deal with drug addiction to prevent the next drug overdose. People who are addicted to drugs, they're taking drugs to escape or to get high. They don't want to die. That's not their goal. And I think we have an opportunity here. We're debating whether or not fentanyl strips should be made available to the public. Something that will put someone in a much better position to make a more informed decision before they ingest a substance. But yet I can go into a number of stores just miles from where I am right now, and I can purchase a pipe, a bong, or a hookah specifically for the purpose to ingest an illicit drug without giving me any information at all of whether or not that drug contains something such as fentanyl that will kill me. And those things can be purchased, yes, in a convenience store, yes, in a business, and we're not even debating. We're not even debating it. We're not even having a conversation about those objects, the pipes, the bongs, the hookahs, the picks, so forth and so on. So now, Representative Yancey, I'd like to open it up for questions at your leisure, sir.
Thank you, Colonel. Are there questions from the committee? Lady from Lincoln, Representative Curry.
Hold on a minute, sir.
No, I got it. I just think I need to say something. Now that I've noticed, for the first committee hearing I've attended, there's a camera on, and I've said to my grandchildren I want to take those strips, but what I meant by that, and I think you've said the same thing, is I have two grandchildren in college, and I think that they're going to have peer pressure that somebody's, and I'm old, going to smoke a joint, and I sure would love to have that with them, if they're going to go to peer pressure, that they know that there's not fentanyl in that. And that's my point. I think we could save a whole lot of lives with those test strips.
Absolutely.
But I looked up just a second ago and I thought, oh my Lord, y'all didn't tell me.
I should have told you.
That's okay.
Yeah.
But anyway, I thank you for what you do. I want to tell everybody I thank y'all for what you do. You're in the fight every day, and we appreciate everybody, but I think there's some good things we can get done.
Yes, ma'am.
Representative from Warren, did you have a question?
No, sir.
Okay. Representative from Lee?
I'm just taking the mic from her. That's
Gentlemen.
Okay. All right. I have one thing I would like to ask you. I thank you guys for what you do. Since we're dealing with a lot of over-the-counter, as they say, things that you can get anytime, do you have any recommendations or anything to combat this crisis? Because what it's saying, we're leading from one drug to another drug, and we don't have all the education. By the time we find out, it's already out of control. So do you have any recommendations, since we're dealing with this crisis that's going on, to combat this, since you're at the ground level dealing with a lot of this stuff and have the knowledge that we don't have sometimes until it really flares up?
Well, what I can tell you specifically with regards to Kratom, and I'm accompanied here by our Lieutenant Colonel of Enforcement, Colonel Eugene Williams, and Northern Region Major Philip Robertson. We have been requested to assist with a number of county boards of supervisors, and also a significant number of city leaders as well, in soliciting information and discussing with them about banning Kratom for sale in their county and in their cities. And right now, we've got more than 23 counties in the state that have banned it, and more than 17 municipalities that have banned the sale of Kratom. And I think that is the best approach when it comes to Kratom until we have more scientific data based on scientific research. I do not think, according to the FDA, that there is a medicinal use right now legitimately for Kratom. So when it comes to Kratom, it should be banned. When it comes to Tianeptine, it should be banned. And any other substance that reacts in the brain as a prescription opioid, where we don't have the scientific data that supports there is a medicinal use for it, I think those products, those chemicals, should be banned for sale in the state of Mississippi. I cannot continue to go into these high schools and middle schools and look into the eyes of these kids and tell them that we're doing everything we can to protect them, to help them close the distance between who they are and who they want to be, the future legislators, doctors, and lawyers, and school teachers, and not sit here and say that in their best interest and our best interest, those chemicals and drugs should be banned for sale here in the state of Mississippi.
Thank you.
Are there any further questions? Thank you, Colonel. I appreciate you coming today and appreciate what the Bureau of Narcotics does every day out there. Appreciate all you guys that are here. I know you got a tough job, and we appreciate it.
Thank you, sir.
At this time, we're going to take a 10-15 minute break and come back, and we'll shift gears and go into cannabis, CBD, Delta-8, etc. So about 3:40, you'll be back at 3:40.
How you resist?
Our next presenter is Dr. Dan Edney, our new state medical officer, state health officer. I guess that's your title.
That's it.
And I've asked him to give us an overview of where we are with the Mississippi Medical Cannabis Act and number of licenses that have been issued, that sort of thing. And I'll let you go and let you comment also on any of the other speakers' presentations, because I know that you have some expertise in those areas, and we would appreciate hearing your point of view as well. Thank you for being here.
Thank you so much for that opportunity. The cannabis program is part of my job, and I'm pleased and will do the best I can, but the first section is my passion. And unfortunately, everything the speakers today from the medical side and law enforcement are unfortunately very true. And from a public health perspective, the opioid crisis is top attention for us. One of the benefits of being the state health officer is I have access to real-time data, and three numbers I look at the beginning of every month is how many mothers died in the perinatal period in the last month, how many babies died, and how many unintentional overdose deaths have we recorded. And I actually got the report this morning, and as of today, we're looking at 788 unintentional overdose deaths in Mississippi, which is astronomical. I can tell you, before the opioid crisis, back in the old days, we would look at maybe 25 to 30 deaths per year. And then even in the midst of the pre-COVID opioid crisis, it got up to maybe 300 or so. And now with fentanyl hitting its full force, we're at 788. Last year was maybe 590. So that's a very alarming escalation. So I definitely want to support the testimonies. I'd like to throw some common sense in, if I may. With everything we do in medicine and in pharmaceuticals, there is an obligation to demonstrate safety and efficacy, and somehow our gas station products have bypassed that. And I would challenge the Kratom industry that actually the burden of proof should be on you to demonstrate that you're safe and effective, and not on us. There should not be any products, in my opinion, in the gas stations that we have not proven to be safe and effective, and at least not be causing harm. And you heard significant testimony to the contrary today. I can't tell you the Tianeptine issue that Dr. Bryan testified on is escalating. 2 years ago, I saw 0 in my practice. We're up to seeing 3 to 4. If you can find them, they're hard to diagnose, but it's now a poison control report. We have doctors calling around the state into the Poison Control Center to report Tianeptine overdoses, and those numbers are going up. And for the fentanyl test strips, it is important to understand that how these are being used, and I can actually use y'all's help at Ole Miss. I'm having some trouble distributing Narcan up there, and that's extremely important that we get Narcan on the campuses around the state. But how they're being used, whether we like it or not, parties on campus, they're just popping pills. And as Colonel Maxwell said, you cannot tell the difference. And the recent overdose death we had at Ole Miss was a student thinking they were taking Xanax, and it actually turned out to be a fentanyl press tab and was lethal. If we have the test strips, if we let them use it, I'd rather they test what they're about to take, because they're going to take it. And if it's fentanyl, throw it away. If it's Adderall like they hope it is, then at least Adderall won't kill them. And like Dr. Panel said, it's hard to treat a dead patient. So fentanyl test strips purely harm reduction and gives us a chance to engage them in treatment. So I hardly endorse those testimonies. Now, pivoting to cannabis, I'm pleased to say that I have Chris Jones-Adcock with me, who is our program manager for cannabis, and she and her team get all the credit for this program standing up so very quickly. Y'all know we had a very short timeline, and we've had great cooperation between the Department of Health and Department of Revenue. Really have been hand in glove, I would say, and so I just applaud DOR's work, and it's been a great example of interagency cooperation at state government, and really how other things need to be. We are online with everything. My main concern is that we have a bottleneck at testing. We have one lab with a provisional license that we're working with who is not ready to start testing product. And until we get a lab, then the supply chain is stuck. We have, and I've given you a copy of the most recent data for all the licensees that we have. That includes all the growers and processors and transporters and labs and the waste disposal ones, and also the practitioners and the potential patients. I will say that the number of patients is low, and it is a bit of a concern because we have a whole lot of product in the pipeline, and the patient count is not where it needs to be yet, but it's still early. A lot of patients know we have the 1 year time limit, and if they get their certification now and there's no product available, then it's time that's wasted. So a lot of folks are waiting till probably November, December, maybe January to get certified. The numbers are going up. They're well below where they need to be to consume the amount of product, in my opinion, that's being produced. And so that's a concern that we all need to pay attention to on the regulatory side. So you can see that registered practitioners, we have a total of 96. That's mostly physicians, 83, nurse practitioners, 10, and optometrists, 3. I'm speaking to the Mississippi Nurses Association in 2 weeks, and we'll be talking with them about the cannabis program in more detail and answering their questions. And when I'm asked my opinion on the medical cannabis program, I even as an addiction doctor, I remind them that I was an internist for a very long time and did hospice work for a very long time, and I see a very important role for medical cannabis when it's used appropriately. And the training that our practitioners are going through are showing them the risk and the benefits and how good ways to apply and use medical cannabis. And I think the holdup right now, there are a lot of regular doctors that I talk to who are interested, but they're not sure, and they're kind of in a wait-and-see approach. I'm actually encouraging them to go ahead and get certified. I went through the certification process. I wanted to see what it was like and how burdensome it was. It was great. Chris didn't even know I was doing it. Slipped kind of past her. I'm the governor's appointee to the Cannabis Commission, and I think if you're going to be on the Cannabis Commission, you need to have gone through everything a practitioner goes through. So I think it's very reasonable. That's not a holdup, and I really think that we'll have an increase in numbers more towards the end of the year, and as the word gets out among regular practicing physicians, not necessarily those that are going to do cannabis only, but the ones who are going to incorporate it into their practice, I think we'll see an uptick there. I think the ones who are going to do cannabis only probably are going through the pipeline right now because product should be available.
Tested product.
Tested product. That's very important. Tested product. There's product available now, but it's not legal. It's not tested. It's not in the dispensaries. But by the end of the year, as long as we get our laboratory stuff worked out, which I'm confident we will very soon. So I've given you the data. I'll be happy to answer any specific questions. More importantly, probably Chris will.
I have a question. Just as far as the bottleneck with the testing, I know that you're working with a testing facility to try to get them up and running, and I know there are other testing facilities that I've heard about, across the state. How long do you? I mean, of course, it's not up to you. It's up to them getting compliant. But how long would you think it would take for this bottleneck to be, gone?
So we anticipate that it'll probably be by the end of the year. What we're going through now with the one that is provisionally licensed is they have about 7 test methods that they have to have validated. And they've had 1 test method validated and are working on their other 6.
Okay. I mean, we want the testers to do it right.
That's right.
So,
and I do want to commend Dr. Daphne Ware, who runs our public health lab, which is a phenomenal asset to the state in so many ways. But she really is working very hard, in my estimation, trying to help the first lab get online appropriately, and then we have
One additional bit
one for sure,
in one company.
one, so perhaps three, but if we could get one up and running, then we can get product moving.
You mentioned that this testing facility is provisionally licensed, and maybe clarify what that means to the committee.
Sure. So when they're provisionally licensed, we go ahead and license them to see that they're doing their due diligence towards compliance. We're really looking for, are they promoting a will to comply during that provisional period? So there are going to be some things that they're working out. They're fine-tuning standard operating procedures. They're going through validation for test methods. They're showing staff competencies in those testing methods. So it's really a provisional period for them to get up and running and strengthen their practices before they move to regular licensure.
And I would remind the committee that right now we're still very early in the program. Our program needs some time to mature. We still are working on staffing, which state government's not the easiest thing to get people on board, and we're running into that. But we've got to get our investigators online and to really be a robust regulator of this very important industry. Right now, everyone is in a provisional period, and that's important to understand. And I've made the conscious decision, working with Chris, that during the provisional period, we're learning a lot, and there are a lot of probably the smaller growers who are learning a lot, and we've made an intentional decision to work with them and to cite noncompliance and deal with noncompliance and deal with it significantly, but to work to provide technical assistance and get everyone that's one of our licensees into compliance during the provisional period. And then certainly once full licensure is in effect, our expectation is that all licensees will fully comply at all times.
Are there questions from the committee? Gentleman from Lee, Representative
Since
Thomas.
you said, thank you. Since you said provisional, how long will you have the provisional timeline? Year, 2 years? What's the timeline on provisional?
4 months. So it's long enough to get compliance in line and to get the help you need and to understand what our expectations are. But as I have shared with many people, my number one concern in regulating the medical cannabis program is, number one, to protect the public. Number two is to have an effective and efficient program that serves the medical needs of Mississippians. But in all things that we regulate, protecting the public is first and foremost. So 4 months, I think, is adequate for us to get everybody where they need to be, us included. And then, we will be using our full regulatory authority for our full licensees.
Will there be any extension, anything like if you don't meet the requirements in 4 months?
So there will be some, because some of them may be doing construction during that period. So we would administratively look at that and whether or not we would extend, because they may have construction going on that they would need an extension during that time.
And how would you, when you say construction, what would you be looking at for as construction for that part? What all part are you looking for to extend that?
So we've been pretty transparent in our regulations, and we outline specifically what we're looking for to move from provisional to regular. So we're looking for connectivity with the seed-to-sale system to make sure that they're reporting into that system and that they're tagging their plants properly. We're looking at their security measures, so we're looking at video surveillance. We're looking at their physical measures that they're taking. We're looking at their record keeping to see what they're applying to the plants at all times and making sure that they're tracking that. And we're also even looking at record keeping related to employment practices to make sure that they have those work permits that they're supposed to have.
Okay. Next question, do you have a policy in place if they do not meet the provisional? Since you said 4 months, what policy do you have in place if you want to, say, get reinstated when you do not meet all the requirements?
Well, what we plan with our full licensees to have the same attitude we do in other entities that we regulate. Very commonly, we will have a different level of violation. Level A violation would be serious, egregious, and needs to be dealt with immediately at a higher level of corrective action. Level B is we're citing noncompliance, but there's not a danger to the public safety that we see, and we can work with you with technical assistance and bring you back and give you work with you to have a corrective action plan to get back into compliance. And then a level C would be, all right, we're seeing some things that maybe you could do better. We're not going to cite you. We do this in restaurants, maybe work on this area a little bit better before we come back, but we're not going to give you a citation for level C.
Okay. Thank you.
Yes, sir.
Gentleman from Warren, Representative Denton, you're recognized for a question.
Thanks, sir. How you doing, Doc?
I'm well.
Good. This question, and I really want to say to everyone, all our speakers, I appreciate everybody for being here, taking up your time to be here. This question is really not specifically about cannabis. Dr. Edney has just hit me. We've been talking so much about the strips for testing fentanyl. Is that a user-friendly strip? If you can answer that question, or anybody on the panel, I mean, how does it work? Because I've never seen the strip so. Yes, how does that work?
If you may be familiar with urine test strips, diabetics will use to check blood sugar in the urine, that kind of thing. It works very similar to that, where most commonly in addiction medicine, we use it to test urine to see if fentanyl's in the urine. And fentanyl and Tianeptine, Kratom, all three are very hard to detect unless you send it off for the expensive testing. So there are Kratom test strips and fentanyl test strips that are more expensive, but you just bring them in contact with the substance, and if it'll change color if there's that substance present.
Right. Thanks, sir.
Thank you.
Gentleman from Madison, Representative Baumgart, Vice Chairman, you're recognized.
Thank you, Mr. Chairman. Well, I just wanted to thank the Department of Health and Department of Revenue. I think I've looked at what some of the other states are doing and how long it's taken for them to get programs up and running, how dysfunctional that process has been in many states where there has not been collaboration and they have not, put the patient first and really try to do it right. I think what we're doing in Mississippi is a model for the nation. I think it's something we can all be really proud of, and we're cheering you on. So thank you for the incredible efficiency, professionalism, and I think it's a model for the nation. I think a lot of people will look to Mississippi for years in the future to say, this is how to do a medical marijuana program right. And I think we should all be really proud of that. And we're very thankful for your hard work. So thank you.
Thank you, Mr. Vice Chairman.
I paid him to say all that. He needed the cash. I hesitate to ask this question, but are there any tweaks to the bill, to the law, that you think that we should make in January, and what would you recommend for us?
Mr. Chairman, are you saying if I were king of the world, how I would?
King of the world.
There might be some, honestly, I think it's too soon. I would prefer that we had at least a year of operations and have a chance to get input from industry about how life is on their side of the street. I'll be able to tell you how things regulatory-wise on our side of the street will be running. We already have identified some things that could be simple fixes, but nothing huge. Now, I've heard 1,000 recommendations on how it could be better. That usually is somebody making it better for them. And when I'm looking at the rules and regs of the Mississippi State Department of Health, it is to protect the public and be able to run a competent medical marijuana program. So some of our rules and regs are a little strict in areas, but where they are, there's a reason for it, and we are very happy to defend those. When it doesn't, but there are rules and regs that don't apply to public safety or diversion, and I'm totally happy to look at regulatory changes if y'all think they would be helpful. Statutory changes, I don't have anything just yet, but I will be happy. I've told people that I'm not going to have a cannabis agenda at the session, but I'll be happy to answer questions and be a resource, and Chris will as well, to help y'all as much as we can.
If you don't mind, mention to the committee about your Department of Health board meeting coming up on Wednesday, on being available to watch on YouTube or however you watch it.
Absolutely. Yes, sir. We have our quarterly Board of Health meeting this Wednesday, and it is available through YouTube with our health department recording, so you can watch it live or you can pull it up on YouTube later. We will be doing a review of what's going on in epidemiology, and that will include Ebola, which is a concern, believe it or not, we'll be doing an update there. You'll get a City of Jackson water update, and I can tell you we're way better than we were. And you'll get a good solid cannabis update to look at. And we've already prepared our board to have an open and honest and transparent discussion about any criticisms that may or may not have been in the media lately, so that everybody knows what our attitude is and what we expect going forward, and how we'll be able to work cooperatively, but make sure that we fulfill our regulatory obligations. So that will be open discussion, open to the public, and would encourage those to tune in.
I want to publicly say thank you to Chris Adcock for all that she's done to get this program up and running. And you've had a big job in front of you, and you still have a big job in front of you. And I, for one, appreciate the job that you're doing. Thank you very much. Dr. Edney, we're glad to have you on board, and we look forward to working with you. Thank you for being here today.
Thank you so much.
Our next speaker is Dr. Larry Walker, who is joining us by Zoom. Dr. Walker is famous for his work at Ole Miss in the Research and Pharmaceutical Sciences program. He'll be speaking to us today about CBD and Delta-8, and he had a little cataract surgery this morning, so we're praying for your full recovery. So thank you for being here, Dr. Walker. The floor is yours.
Thank you. Can you hear me?
Yes, sir.
Thank you so much, Representative Yancey, for the opportunity to speak to you. I'm sorry I couldn't be there in person today. I've been a faculty member and researcher in Ole Miss for more than 40 years, and a lot of it I've been involved with our research program on cannabis. I want to talk a little bit about some ramifications of things going on in the cannabis world. This is somewhat separate from the medical marijuana program, from the state medical cannabis program, a little bit of a separate issue. So if you bear with me, and I'll make this as brief as I can. The 2018 Farm Bill was clearly intended to remove restrictions on the uses of industrial hemp and to allow the production of hemp-derived CBD, cannabinoid, for commercial purposes. But it's introduced a new set of problems in the U.S. that really weren't intended and weren't anticipated, I think. And they essentially hinge on the legal definitions of hemp and hemp-derived and how they're interpreted by the courts, how they're interpreted by law enforcement, and so forth. Basically, the Farm Bill redefined hemp to be cannabis with no more than 0.3% Delta-8 THC. And anything derived from hemp, anything derived from what would be classified as hemp, if it doesn't exceed that Delta-9 THC limit, it's no longer a controlled substance in the U.S. So I want to organize my concerns and I want to talk about three major points. First, CBD oral products. Second, CBD vape products. And then third, Delta-8 THC containing products. And I'll be happy to provide for the committee published documentation on these points that I'm going to make. First of all, CBD oral products. The perception is widely held that CBD is a harmless cannabinoid. And I want to underscore that while authentic, good quality CBD is relatively safe for oral consumption at low doses by healthy individuals, there is some potential for it to negatively impact liver function and to interact with prescription drugs, and so use indiscriminately in certain populations or under certain conditions may have negative health consequences. Hemp-derived CBD, though it's no longer restricted under the Controlled Substance Act, it's still not legally allowed as an ingredient in dietary supplements under the FDA regulations. This is not being reinforced. This is not being CBD that have drug-type claims. The problem is really that the popularity of CBD, with the removal of the controlled substance restrictions, it's really opened the door for a lot of unscrupulous manufacturers who are hawking products that are substandard and sometimes even fraudulent. Several studies we've done in OMS and other research groups have demonstrated this over and over again. This has led to a lot of products in the market that are at least poor quality and maybe even worse. But I want to turn to talk next about CBD vape products. Manufacturers have taken advantage of the vaping trends among young people to market vape cartridges containing CBD. Right now, the health risks of vaping CBD are completely unknown. Any health benefit that might be derived from CBD by vaping is also unknown. These vape products constitute an important potential health risk, especially for young people, because they're marketed, as we've heard from these other products earlier in the hearing, they're marketed very indiscriminately in all kinds of dubious ways and packaged in attractive ways to attract young people. Now, because CBD doesn't really produce a high, some vape manufacturers have moved to include different types of illicit ingredients that would give a buzz to encourage repeat business. So these products, again, are kind of hawked, and you don't know what you're getting in any of these gas station fronts or convenience store fronts. And that really brings me to talk about Delta-8, which is kind of a unique problem and really a growing problem. Delta-8 THC. It's essentially the same pharmacology as Delta-9 THC in terms of its psychomotor effects and its abuse potential. So it's basically just like Delta-9. Because CBD can be chemically converted to Delta-8 THC, this has prompted a lot of manufacturers to do this. So they'll chemically convert the CBD, which is not a controlled substance, and to sell a range of products that have Delta-8 THC in them, because it will give you the high, it's very popular among those who would like to use that, or those who are being encouraged along that line. And so it's given manufacturers a way to get another edge in this really competitive CBD market. And it's really important to note that these conversion processes, converting CBD to Delta-8 THC, is not clean. It involves strong industrial acids, solvents, high heat. There are many other ingredients that are produced from this in this reaction mix, and it's very difficult to clean it up. It's very expensive to clean it up. And so when we're vaping products, or even oral administration of these products, it's really risky business. There's a lot of stuff in there that we just don't know what it is. The interpretation that Delta-8 THC is legal is based on the fact that it's derived from hemp, and it is presumably less than 0.3% Delta-9 THC, so it's technically not a controlled substance. This was clearly not the intent of Congress, but that's where the law reads right now. And this interpretation has been given kind of a, you might say, an affirmation in the courts, because in the Ninth Circuit Appeals Court it wasn't really about Delta-8 THC legality per se, but this came up in the trial with one of the plaintiff's arguments. And in the final analysis, the court agreed with the plaintiff that although they felt like it was not the intent of Congress, this is where we stand, that Delta-8 THC could be interpreted as not a controlled substance. So, again, these products are out there being promoted as vape products, being promoted as completely legal, as non-controlled substances, and so all of these being promoted and marketed aggressively, targeting young people in a variety of ways, including these storefronts that we've talked about at the cash register, as you check out. I really think, our law enforcement is overwhelmed to policing all of these, and the prospect for charging and prosecuting and convicting them under federal law is essentially zero right now. So this disarray is really led many states to think about their own avenues for addressing these potential consumer risks. So this is a little bit different angle from the earlier speakers, but it's very similar public face of the problem that we face. So I'll stop there and I'll be happy to answer questions.
Are there any questions from the committee? Dr. Walker, I think you did such a great job that no one has any questions. We thank you so much for being with us today, and get well soon on your eye. I hope everything works out great, and I look forward to seeing you soon.
Will do, and I'll see you soon.
Yes, sir. Thank you, sir. Our next speaker is Leslie Engelking from Focus. She'll be talking to us about CBD and Delta-8 as well. Hope Dr. Walker didn't steal all your thunder.
No.
But I'm sure maybe it's complimentary to what you're doing. Is that all one thing?
We'll just keep going so we're not keeping you waiting too long. I am Leslie Engelking, and I am founder of Focus. And I'm working as one of the key doctors, so bear with me as I try to...
I cannot hear a thing.
I'm sure what actually is right. There we go. So I'll tell you a little bit about my background quickly.
We need you to have a microphone. Yeah.
I don't.
Let's see how far the cord will go.
That's all right.
There we go. Yeah, sorry.
Is that better? Okay, I'll start again. Thanks so much for having me here. I'm Leslie Engelking, and right now I run a cannabis health and safety organization, but before I started, my background is in mental health and public health. I spent 13 years at Eli Lilly and Company, and then I opened the first chain of vertically integrated cannabis licenses in Phoenix, Arizona, under the medical law. So I'm going to talk to you today about my experience first running a cannabis business. That was it. I started a nonprofit health and safety organization because running a cannabis business is hard, and because state regulations in their programs rely on testing instead of operational guidance. And so rather than continue to build my business, I decided to start a nonprofit that would help operators run their businesses better and help regulators write better rules and implement programs. So that's my company, Focus, Foundation of Cannabis Unified Standards. We've been in existence since 2014. We work in 29 states and 14 countries currently. A little bit of an update here. So just to give you an idea where we are with cannabis in the United States, this is a poll that was just done this summer by SICBA, a Harris poll, and there are actually now more people smoking cannabis than there are tobacco. So it's a public health issue for sure, whether or not it's in your state, whether or not it's in your family. This is just some of the data. So the poll was done in April. They looked at just over 2,000 patients. About half of them had used cannabis before. And 77% of patients support the government setting standards for product quality and safety, which has clearly not happened yet. just to give you an idea of why we're seeing these problems with Delta-8 and CBD, I need to show you where the regulated state programs are. If you can see, the dark green is adult and medical use. The very light green is CBD or low THC program, and then the bright green is a comprehensive medical and cannabis program. And the reason I want to point this out is because of the next slide. These are actually medical and adult use cannabis programs now. And as you can see, there's a lot more gray on this map than there is on that. The difference is a lot of these low CBD, low THC markets have come across. Let's see if I can go back and show you. So you can see there's 3 gray states, and look at the difference there. The reason I point this out is because this is where a lot of the issues came from, is these low CBD programs. As Dr. Walker pointed out, we've got a lot of these products just flooding the market, and it wasn't the intent of the Farm Bill. And so when you look today at data in the United States about how much of the demand for cannabis is actually being met by legal markets, it's just about half. And even through 2030, we're not going to get there. And so what that says is we need to be mindful in our regulation that we are trying to control the illicit market, not just create a regulated market for taxes, right? Like the goal of creating the program should be to get rid of the illicit market. When you look at the largest illicit markets in the country, they are all states without programs. So there's a direct correlation between that that's been shown, and there's billions and billions of dollars being lost because of it. But as Dr. Walker said, what happened after the Farm Bill was passed? The intent was not to legalize intoxicating products for everyone to have, but that's exactly what's happened. Why did that happen? Well, from an industry sort of insider perspective, there was all these things that changed. So within 45 days, the prices of CBD dropped 30%. All the hemp planted grew dramatically from 32,000 acres to 146. The price of a single kilo of CBD oil could go for up to $70,000 at the time that passed. In 2002, that same price is $750. So all these farmers, all these manufacturers, and all these retailers that have put all their money into building these businesses now are trying to find a way to survive. The other big thing that hasn't happened is we thought we would see federal regulations for the manufacturing side of CBD and hemp after the Farm Bill passed, and we have not. But again, the intent was not to legalize that, and I certainly don't think it's the intent of those here in Mississippi to have intoxicating products on the shelves of your convenience stores and things like that. This is a struggle across the country. You guys are not alone in trying to figure out how to regulate this. Even if you can't see exactly what that says, you can see a lot of different colors. Some states allow it in food, some states don't allow it at all, some states let it sell in their medical program. Pretty much this is a problem across the country, and it is because of this district court decision, or federal court decision, that Dr. Walker referred to. So how did the industry get here? Well, hemp's legal. CBD extracted from hemp, also legal. There's little bits of Delta-8 that show up naturally in this process. So Delta-8's naturally occurring. Why wouldn't we be able to make it from CBD? It's not good logic, but it's the logic. The problem is that there's this chemical conversion process that happens when you're taking CBD into Delta-8, and it makes really nasty, dirty chemicals. You can see, and I know Dr. Walker talked about this, and Blake is going to tell you, I'll leave it to the scientists and the physicians, but there's a lot of different products that show up. We don't know what's going to show up, so we can't test for things that we don't know. It's also really difficult to separate Delta-9 from Delta-8 or Delta-6 when you're doing lab testing. And so these labs are testing for THC and the other things that are required in your medical programs or in a state's adult use program, but they're showing up on the certificate of analysis with all these different unknown constituents at the bottom. There's little peaks that have not been identified, and we don't have any safety data on. Again, just more on this. The producers don't know that this is happening. I don't think the intent by anybody in the industry is really out there to hurt people, but we've gotten to this place where all these products are sold on shelves everywhere. I mean, literally, there was a coffee shop like a Starbucks, it wasn't Starbucks, but in Chicago, downtown Chicago, selling shots of Delta-8 THC, which gets you high just like Delta-9, in coffee to people that had been buying CBD shots that wouldn't get them high. No enforcement, no oversight. The coffee shop didn't know the difference. When we went in to talk to them about it, they just said, well, what do you mean? It's like CBD. So it's a problem. Those people are in their cars driving to work, right, or with their children or whatever they're doing. We see study after study. I chose one to exemplify this, but they looked at 80 different hemp products that are commercially available. 37 products were at least 10% up or down from the stated strength. But what gets scarier is 12 were greater than 90% of the stated strength, and 25 were greater than 110%. So the labeling doesn't matter. There isn't any oversight for these products. They're sold online and Amazon and everywhere else. So consumers just really don't know what they're getting. This is from Proverty Labs, and Chris Hudala is the chief scientific officer there, and he's a good friend and colleague, so I'm stealing his. When we look at the chromatographs, we expect to see 1 or 2 peaks for Delta-9, maybe some CBN or CBD, but you can see all these red question marks, and the other indications are all different chemical constituents that are showing up in this vape pen. And those are not being reported on a C of A because it's not required by law. This is the same. This is just with gummies instead. And you can see they do look like kids' candies and things like that, but 47% of the signal is due to things that are not natural. So we hear a lot in this industry that cannabis never hurt anybody. And that's true as a plant growing wild, or maybe even, smoking it in your backyard. But when we're making chemical conversions, we're doing it at scale, the risks are much greater. That's not very good. Anyway, FDA, CDC, almost every organization out there involved in this has reported serious health risks with these products. The FDA had a study looking at poison control data just from December to the end of February, so 3 months, and 87% of the people that reported adverse events with this ended up hospitalized. So we're getting better and better data to show that we just don't know what's in there. That's not to say these products are terrible. They could be great, but pharmaceutical products belong in pharmaceutical labs, and for the most part, the industry is just not prepared to make these safely yet. I don't even think I'm going to talk about. So one of the things I want to leave you with, if you're trying to decide on what to do about Delta-8 and these other synthetics, because there's Delta-10, Delta-6, THCP, THCO, and there's going to continue to be more, is think about the fact that 2 things. One, the Farm Bill is going to be rewritten in the next 8 months or so. And you better believe everybody in DC is worried about this right now. So there will be some changes on the federal level to correct for this problem. The other thing I urge you to think about is you've got a new marijuana program, medical cannabis program. You have a lot of oversight and authority that needs to happen there. And by letting these products into your program or into your state can create a lot more confusion and difficulty for your health department, for your law enforcement, for your hospitals, everything. So this is actually a framework that my company is working on with the Association of Food and Drug Officials to build a national framework for cannabis in the United States. It's not building regulations. It's trying to decide how do we regulate cannabis like we do corn. So it's an agricultural crop in the field. It's a pharmaceutical when it's processed. It goes in a food or a beverage, but it can also be a medicine. And so we're working on pathways so that we can figure out a way to prioritize public health and safety first and find a way for cannabis to exist in a way that's safe for everybody. So I'll leave it there. I have time to answer questions if you want, and I'm around after.
Thank you so much. Are there any questions from the committee? Do you guys see Colonel Maxwell's not here anymore? He talked about the vape cartridges that the kids were buying before school. Are these the vape cartridges where they
Absolutely.
He's talking about CBD.
So any product can be made with Delta-8 that can be made with THC. And the problem is these products are being sold at gas stations, convenience stores, grocery stores, vape shops, and you can go in there and buy them without a marijuana card or a cannabis card, and you don't have to pay these enormous taxes, and kids get them. I mean, I've got nieces and nephews that are all in their teens, and it scares me to death that they could get these.
Kids don't have to be a certain age to buy CBD. There's no law that says they have to be 18 or 21, or can't buy cigarettes, but they can buy Delta-8. Wow.
It wasn't intended to go this way, right? So the laws weren't written for this to be sold all over the country in all these stores. We haven't gotten there yet. It's just happened as a result of legislative changes at the federal level.
Leslie, thank you so much for being
Thanks for
with us
having me.
today. Our final speaker of the day is Blake Smith. Blake's the Chief Science Officer at Southern Sky Brands. He's going to also talk about CBD, Delta-8, and I first heard him at a conference in Salt Lake City, and he's an expert on all kinds of cannabinoids, and you might go into some of that if you don't mind and kind of educate our committee. We're familiar with THC and now CBD, but there are many more, as we all know. And
there are a lot of cannabinoids.
And so tell us a little about your background and how you got where you are, and then whatever you want to say.
All right. I have a short time period, so I'll try to be quick on.
You're the last speaker, and, we have dinner at 6:30, so you're good.
Oh, good. I'm going to take my jacket off. I do have to say I really appreciate all the presentations today. It's really fun and refreshing for me when I get to hear other people talk about neurotransmitters. And I think everyone here gets a PhD in systems pharmacology today. So that's awesome. My background, my name is Blake Smith, and I'm a bioanalytical chemist. I started off in the pharmaceutical industry. Oh my gosh, it's been about 25 years now. And my expertise is in pharmacokinetics and pharmacodynamics. I used to make medicines for MPS Pharmaceuticals and Celgene Pharmaceuticals. And then I went to academia after that. I have also a background in Masters in Public Health, where I specialize in biostatistical analysis and also epidemiology. I ended up, I was never a cannabis user, despite the way that I look. I was not a cannabis user, and I actually worked, my last job that I had prior to doing this, I was at the University of Utah, and I was over environmental health and safety for the entire University of Utah healthcare network. I had about 11 million square feet, fire marshals, and everybody was reporting up through me, and I also taught intervention radiology and the effects of chemotherapy on the immune system in the med school. During that time period, my daughter was diagnosed with a genetic condition that gave her a predilection for seizures. Current medications were not effective for my daughter. We belonged to a parents' alliance, and they suggested that cannabis might be effective, and we're all familiar with like Charlotte's Web and so forth. And so at the time, I went and collected product from all over the country and different things, but I didn't give it to my daughter. That would be irresponsible. Took it back to my laboratory, and I started analyzing everything, mass spectrometer, NMR, and so forth. And what I discovered is products were not what people said they were. There was pesticide residues, there was solvent residues, there was metals, the potencies weren't what anyone said they were. You have all of these peaks that everyone's talking about that showed up randomly that nobody would identify, and quite frankly, that horrified me. Coming from a pharmaceutical background, it becomes very, very clear that there are certain rules in place and ways you do business and science to make sure that you have safe product. And so we do ADME testing, administration, metabolism, distribution, and excretion. We would do pharmacokinetics, we do pharmacodynamics, we do toxicity, we do microsomal studies in the liver. We do a whole slew of testing to ensure that something is safe. One of the things that I found out, so I, just to continue the story and move this along, I left my career. I ended up in the deserts of Tonopah, Nevada, and I ended up growing 1,200 acres of industrial hemp. I built one of the largest processing facilities at the time in the U.S., and what I did is I started isolating the specific cannabinoids and started trying to figure out the mechanism of action of how they actually work. In doing so, we found a molecule, CBC, that actually affects acetyl-CoA formation in the brain and energetic interactions. My daughter, in her condition, she does not have that natural feedback loop of energy regulation, and she has been seizure-free for 6 years. So, at the end of the day, I won, which is also one of the reasons why I actually am very careful about how I align what I do in this industry and who I align with. I have my own companies in Utah, and I ended up with Southern Sky specifically because they care about the medicine, and they keep portraying to me they want this to be medical. Medical states have some very interesting characteristics that are different from recreation markets. First and foremost, medical states have innovation. You look for specific cannabinoids for specific physiological conditions to help. For example, if we look at pain pathways that follow the AG neurotransmission pathway, stubbing your toe, you get a signal, you enact the central nervous system, it has a fight or flight response, you increase your immune response as well as epinephrine and so forth and so on, until your brain catches up and says, I stubbed my toe, I'm not being eaten by a lion. And then you have to enact the parasympathetic nervous system, start backing everything off, norepinephrine to counteract, and so forth. Well, when people talk about cannabinoids, it's amazing to look at how cannabinoids mimic natural neurotransmitters we are already producing. How is it that this plant or our bodies know what to do with certain molecules? And this is where the medicine comes in. We are not creating synthetics. We're not creating things that your body doesn't know what to do with and now has to react. One of the problems with opioids, and we talked about carfentanil and fentanyl, you start forming these deep synaptic grooves that your body is not used to having, and then you form these dependencies upon them. And so all of your actions start to go down this pathway of reinforcing this addiction. Natural compounds that your body knows what to do with doesn't seem to have this same addiction level. Now, that doesn't mean you can't have habitualization. We all have habits for all kinds of different things. Cannabis can be definitely habitualized, but it doesn't typically form these addictive synaptic deep grooves that form. Having said that, some of these synthetics that we're seeing hit the market that people are able to take, THCP, THCO, some of these have these negative effects. And as of right now, they're not being regulated. That's an extreme challenge. Some of the things that I passed out to you, and I would love to spend as much time as we all wanted talking about specific other neurotransmitters, how CBN works, CBG, CBD, THCV, CBDV, there's a whole slew of them. For cancer patients, we want to stimulate appetite. We've isolated the molecule that gives you the munchies. Everyone always jokes that they want Cheetos and brownies and whatever. There's a molecule that does that, and we can give that to cancer patients to stimulate appetite, and it doesn't get you high. That's really cool. That's what we're talking about when we talk about medicine. Delta-8 that's made by taking CBD and dumping in pounds of hydrochloric acid into it, cooking it in a bathtub at 250 degrees, and then putting it in a vape cart and giving it to a kid, that's not medicine. That's not what we're talking about in the industry. And will it get you high? It will, but it also leads to a lot of the things that Dr. Walker and Leslie were talking about, and that's extremely problematic. And the issue with the Farm Bill is the cat's out of the bag. It is really hard to start bringing this back, because I just went to a convenience store not that long ago when I first got here, and I could find all kinds of products, anything from Kratom to anything else you can possibly imagine. Just because something doesn't have definitive data that says it is not efficacious or something like that does not mean it has safety. Just because we haven't shown it killed somebody doesn't mean it's a safe or good product. Just because we haven't shown that it's necessarily good doesn't mean that it's good for you. I'm always floored by the supplement market that basically says, oh, take this lavender, it helps 900,000 conditions. I'm not going to knock lavender. Maybe it does. Maybe it does help. But scientifically, I can't prove that. I can't show the mechanism of action of how it works. This is one of the things that makes good cannabis medicine extremely important. We are now, that the federal government is allowing us to do studies, like with Old Miss, we can actually start determining the mechanism of action of how these compounds work. And in the case of my daughter, it doesn't require THC at all. It's other cannabinoids. Now, are there times and places where THC is appropriate? Yes, but I think we should be treating it like a compound pharmacy, the right tool for the right condition. And if we do that correctly, we can mix the right cannabinoids in proper forms to have the right conditions being met. Okay, having said that, I handed out a couple papers. I apologize flat out. This was written for the scientific community. We are some of the individuals at my laboratory in Utah who have actually isolated and shown what some of these unknown compounds are. We actually, when people say this is unknown, we have figured this out. And so what I really want to point to is there you have a report that says detailed comparison. I want to focus, you can read that on your own. It's such great reading. I'm sure it'll be enthralling for everybody. But basically, I want to go to the conclusions. And this is where I'd like to spend just a minute of time if we can. This is done by an independent laboratory who took our results and verified our results. And so again, how science works is you do science, you send it out to the community of scientists, then they go ahead and they do the same experiments and see if they can get the same results. And if you can repeat that process repeatedly, then as scientists, we can start to agree on data. If you can't do that, so I love when I hear arguments like, well, we got our scientists and you have your scientists. That's wild. I mean, at the end of the day, we should be able to start to sit down and look at data, and we should be able to start to make determinations based on data. So this was done by an independent lab, and this is what it was found. Both through HPLC is high performance liquid chromatography, and GCMS, gas chromatography mass spectrometry, data support the hypothesis that the major unknown cannabinoid peak that is being observed in many distillate samples. And let me point this out because this is extremely important. We have found this in Arkansas, Ohio, Nevada, California, Arizona, Utah, just to name some of the states where we have confirmed that this is some of the unknown peaks that are out there. And because of this, I guarantee that those who are making Delta-8 and Delta-10 in their bathtubs are also creating these compounds. It's pretty much a guarantee. All right. Being observed in many distillate samples during testing is a composite of 4 separate cannabinoids. They are 6A, Delta-10 THC, 6AR, 9S, Delta-10 THC. So what that basically means is it's a chimeric molecule. It has 2 mirror images of each other. A common example that most doctors would be familiar with would be like thalidomide. One kind of thalidomide ultimately prevents pregnancy. The other one causes birth defects. Chiral molecules are particularly dangerous because if you are making it or synthesizing it, you will make both. You will make both ends of it, both the R and the S forms. Okay, so what this also tells us is we actually have 4 molecules. We have a 10R and a 10S, a 6R and a 6S. So that unknown peak isn't 1 peak, it's 4 peaks. Retention times in both instruments are consistent, as are the UV spectra and the HPLC and the fragmentation patterns in the GCMS. Now this is, sorry, I'm going to get a little bit technical here, but this is important. So some people think that if you look at fingerprints, for example, every single human on the planet has a different fingerprint. It's not entirely true. Mostly they're different, right? But it is theoretically possible to get some humans with the same fingerprint. Some molecules weigh the exact same on a mass spectrometer. So this is one of the reasons it's been so hard to find, is because at THC, the mass of THC, people just see THC and they assume that it's Delta-9. Well, what you do to start separating those is you send in mass and you blow fragments. You blow that THC molecule apart to differentiate it from other molecules. And then you have a better idea whether something's different. So if I had another human sitting next to me and we both had the same fingerprint, if our heads look different, height, weight, we can start to look at each other and know that there are differences. That's what you do with a mass spectrometer, is you blow these things apart. When we've tried to fragment, yes?
Let me stop you just for a moment.
Yeah.
Just from a practical standpoint, though, what can our committee do to make it better in Mississippi, in your opinion? Do you see this all across the country? Is there something we can do to regulate CBD so that it's safe for the consumer? It is what they say it is. Can we get Delta-8 and CBD out of the hands of kids? I mean, have you seen something done across the country, and what would you suggest that we do?
The most effective way to deal with this, especially right now in the industry, is you require your laboratories that are testing all of it, test for Delta-10, both forms, RNS, Delta-6, and if they can, they should be testing for THCO, and also all other forms of THC, all the isomers, okay? Test them all. And I would ban all synthetics. There is a list of 11 cannabinoids right now that are in the normal panels for most states that are testing, and every one of those states, those are all naturally formed cannabinoids. Those are cannabinoids that the plant has enzymes that make those molecules. Because of that, I think that's why, it's my opinion, that the body starts to know what to do with those, is because they're naturally occurring. When we start making these synthetics is where we start getting into real trouble. So because of that, I would ban them. Now, with what Leslie said, there's going to be further enlightenment that comes from the National Ag Bill and so forth, but you don't want to always be reacting. This is the biggest challenge. Without enforcement of the law and without adequate rules to ensure the safety of consumers, and I'm going to say in this case, patients, if you don't enforce the rules, what ends up happening is you will come back around this table year after year after year, constantly re-changing all the law to come up with the new way the industry is trying to get something through. Many people are doing this with good intent, and I'm going to tell you this right now, there are many producers who are producing some of these things unintentionally. They're not trying to make bad stuff. This is a legacy thing that has happened from when they were growing in basements and trying to avoid the feds. And so they've carried that knowledge with them into the industry now. But it can be done safely. I know this for a fact because my laboratories in Utah have none of these synthetics. Zero. So the last thing I want to point out is by banning them, then you're going to be ahead of the game on that. All forms of THC that are synthetic cannabinoids are outlawed. And if somebody comes up with something new, and they inevitably will, you make hay while the sun is shining, somebody will come up with something else. It gets covered in the law that if this is considered synthetic, and put the burden of proof on the company to say this is a good compound. This is where they have to go through a full FDA testing and show this is something that's beneficial. And if they can do that, then it should be on the market and it should be prescribed, but they should be willing to put the money where their mouth is on it. Does that answer your question?
It does. You know, it's easy enough, which it's not easy, but it's easy enough to ban all synthetics at the legislature. For products, for CBD products, most of those are created outside the state of Mississippi. So they're either, ordered over the internet or they're brought in, and so they are made, they're manufactured, grown, tested somewhere else where we have no jurisdiction. I mean, that's a federal jurisdiction or the jurisdiction of that particular state. I mean, we could require that any CBD sold in the state of Mississippi has to be grown and tested in the state of Mississippi, I guess, but then you're going to have a place to test it. And as we just heard, we've only got we almost have one testing facility for the medical cannabis program. So, and they have begged me not to give them any other assignment at this point. So
I'm going to be a little bold, and I hope I don't end up with a horse head in my bed or anything, because the industry comes after me.
If you make me an offer I can't refuse, I can't promise you anything.
All right, this is going to be probably wildly unpopular among a lot of people, but I'm going to say this. Basically, every product that comes into the state of Mississippi should be registered with the state of Mississippi. It should come with a COA from a certified laboratory. That means that it meets its ISO standards, GLP standards that are given by the federal government. If they can provide all of those things, then it should be allowed to be sold in the state. Now, here's the thing that's interesting. You have the right to monitor any product coming in and out. That is the right of the state of Mississippi to do that. I promise you right now, You could go into any vape shop or you could go into almost any gas station and find hundreds, if not thousands, of unregistered products. I would set up a fine system for every single product that does not meet the requirements of the state, that they are charged a certain amount of dollars, anything from $250 to $500, and all of a sudden you have enough money to get as many laboratories or as many people to go out and inspect as you want. The state of Utah last year had $9 million in surplus as a result of fines that they were doing, because Utah requires everybody register their products through the state. That's my opinion.
Leslie, what's your idea?
I think that you need to think about consumer education, right? Like, you can do something legally, legislatively, but you don't have the oversight capacity to go and pull this off the shelves and really regulate what's unlimited and pass these laws. What about spending some effort on trying to tell consumers that, hey, CBD, this kind of thing, and what if we get through medical marijuana folks? Consumer education. They're supposed to be educated about medical cannabis anyways. I mean, part of this is just letting people know. If you walk into a certain page and you see something that says, CBD, and people have heard for years now, it's the buzzword that fixes everything, and it's for every kind of condition, they're going to buy it. I mean, I think the drugstore, gas station drugs is the perfect term for that. But what if there was warnings, or what if they couldn't be sold in certain stores? What if there's a way that to public advisors who have consumer education can make it right now?
I would say I agree with Leslie on this as well, as something that has to be done. Even our doctors here who are recommending cannabis for their patients, if they don't understand how multiple cannabinoids work, then what are you really recommending? You're going to turn it over to a bud tender to tell a patient what they need? A care team really does consist of the physician along with the pharmacist and or the expert in that area and the scientist who's making it. We all deserve a care team. We all deserve people who are trying to ensure that we're getting the right medicine for the right condition. And so education is important across the board for all of this. Because if somebody goes in to get gas station CBD and they want it specifically for knee joint pain, it's the wrong cannabinoid. That's not really what they should be doing. They should be asking for CBG, and I promise the 7-Eleven attendant doesn't know the difference. And so it's a real issue.
Well, does anyone on the committee have any questions for Mr. Smith? Lady from Madison, Representative
Can you
Ford.
sing? Because you look just like Chris Stapleton to me.
Maybe for you.
He says he's as smooth as Tennessee whiskey. Any other questions from the committee? I want to thank all of our speakers today. You've all been very, very educational for us, and you did a great job. Committee members, thank you so much for your participation. Everyone who's here, we're around if you want to ask questions or offer suggestions. Thank you so much for all being here today. This committee is adjourned. Thank you, Joel.